Aloha, we are convening the House Committee on Finance for our 10 a.m. agenda. It's Friday, February 27th, 2026. We're in conference room 308, live in person and on Zoom. Some quick refreshers. If you are on Zoom, please stay muted until you're called upon. And we do stick to a 2-minute time limit per testifier. We'll give a little bit of flexibility should you be extremely compelling, that kind of thing. But otherwise, if you can, for the most part, stand on your testimony, unless there's something really critical you need to explain, or if you are going to testify and you have provided written testimony, please try your best to just summarize or provide additional context instead of reading it directly. But other than that, I think we're good to go. We can get started. We're going to open up with HB 816, HD1, relating to emergency response.
First up, we have the Department of Health with comments.
Good morning, Chair, Vice Chair, committee members. Garrett Hall, Chief of Emergency Medical Services and Injury Prevention for the Department of Health. We stand on our written testimony and here to answer any questions you may have.
Thank you. We have Kylie Swan in support on Zoom. Not present. That's everyone who indicated they would be joining us. Members, also testimony in support from Councilmember Kagiwara from the Hawaii County Council and 2 other individuals.
Okay, members, any questions on this measure? Seeing none, we're going to move on to HB 1535, HD1, relating to automated external defibrillators.
We have the Department of Health with comments.
Good morning, Chair, Vice Chair, committee members. Garrett Hall, Chief of EMS at the Department of Health. We stand on our written testimony as submitted and here to answer any questions. Mahalo.
Thank you. Department of Taxation with comments.
Good morning, the text has in our written comments.
Thank you. Tax Foundation of Hawaii with comments on Zoom.
Good morning, Chair, Vice Chair, members of the committee. Tom Yamachika for Tax Foundation. For the reasons stated in our testimony, we think it's a lot more efficient for this to be handled outside the tax system. We have subsidy programs such as high energy. This could be handled, much similarly to that, with, I think, a greater impact and more accountability. Have to answer any questions. Thank you very much.
Thank you. If we have Kylie Swan in support on Zoom. Still not present. That's everyone indicating they'd be joining us. Also, support from 1 organization and 1 individual. Oh, is there anybody else in the room wishing to testify? Anybody on Zoom?
Okay, members, any questions on this measure? Seeing none, we're going to move on to the next item, HB 1537, HD1, relating to mental health.
Department of Health in support.
Good morning, Chair, Vice Chair, and committee members. My name is Kaylee Aquaro. I'm the administrator for the Child and Adolescent Mental Health Division. We stand on our written testimony in support of this measure, and I'm available to answer any questions. Thank you.
Thank you. We have the Hawaii State LGBTQ+ Commission in support on Zoom.
Good morning. Happy Aloha Friday. Michael Galoya Jr., Vice Chair of the Hawaii State LGBTQ+ Commission, he, him pronouns. We stand in strong support of this measure. You have our testimony in front of you. The couple things we do want you to know. Earlier this year, the Lemke Institute, which tracks genocides around the world, issued a warning that the United States is in the early stages of a genocide for the transgender community. What is it? Since the attacks on Mahu transgender and gender nonconforming communities have began last year, we have seen the suicide rates quadruple for this community just in the last 8 months. Bringing it close to home, in this year alone, that we've lost 3 keiki that we know of. The need for access to mental health care is now, was years ago, but the now is now more than ever, as you have in our testimony, you heard from others. We know you're probably not going to amend this bill to include the protected classes that we requested in our testimony, but we do request, if you won't do that, that you at least include the list of protected classes found in our testimony in the committee report. So when this program hopefully goes forward and gets funded, that those that are in charge of the program know that they definitely need to take special consideration for these classes and the special needs. So we encourage you to pass this bill. We hope you amend it, but if not, put it in the committee report. So moving forward. Thank you. And I'm available for any questions. Mahalo.
Thank you. Hawaii Substance Abuse Coalition in support.
Good morning, Chair, Vice Chair, distinguished members. I'm Alan Johnson with the Hawaii Substance Abuse Coalition. We now see that mental health, diagnosable anxiety and depression is just out of sight, up to 40%. It's just unbelievable what's happening in the schools. And as providers with boots on the ground, we know that because we have substance abuse programs in the schools, the high schools and middle schools, and we see that many of them are coping by using substance abuse, alcohol, and tobacco. And the issue is that we have this robust substance abuse program in schools and high schools. There is no mental health program, prevention program in the schools that will deal with families and kids. And the science is there. Providers in substance abuse have evolved in the last 10 years. We now do substance abuse and severely mentally ill for adults and kids. We in substance abuse could deal with the alcohol and mental health in one setting. We have the expertise, but here we're operating in silos with no funding for mental health. We're saying this is an opportunity to evolve our state systems. We're in the schools, we've got relationships with the teachers, the kids, and the school counselors. It's the most economical way ever possible to begin for this state. The science is there to say it's time to evolve mental health, substance abuse together. At one time, we could make a huge difference. We appreciate the opportunity to testify today, and thank you for your time.
Thank you. We have Hina Mauka in support on Zoom.
Aloha, Chair Todd, Vice Chair, and members of the committee. As we have heard here today, what we are really missing is a coordinated approach between mental health and substance abuse prevention. Adolescence is such a critical window of development when young people experience intense emotional change, social pressure, and brain development. And that's also when anxiety, depression, trauma, and other mental health challenges often first appear. What we need to do is be treating those together. We cannot treat them separately because just as adults, adolescents turn to alcohol, vaping, and substances to try to calm their nerves and escape emotional pain. So it's very important to treat all of these challenges at the same time. HB 1537 allows us to integrate that prevention as expressed by other testifiers. We appreciate your time and we thank you for the opportunity to testify. Mahalo.
Thank you. We have Catherine Apelera in support on Zoom.
Aloha, good morning. Thank you, Chair, Vice Chair, and committee members. My name is Catherine Valera, and I stand strongly in support of this bill. And I am a mother of a daughter who died by suicide. Sorry. I just want to share that my daughter was 28 years old. She was a PhD student at UMass. But these things didn't start as an adult. They started early on, probably middle school, high school, and there's really limited access to resources. And I think if we have more preventative and more accessible services, I think a lot of this could be addressed early, caught early. And I really hope that you pass this bill, and I am strongly supportive. Thank you for letting me be here.
Thank you. We have Maya Kopolis in support on Zoom.
Oh, hi. Aloha, Chair, Vice Chair, and members of the committee. My name is Maya Kopolis, and I'm a student at Kalaheo High School, and I'm in strong support of HB 1537. As someone who has firsthand experienced high schools and middle schools in Hawaii, our youth is in a mental health crisis. Over a quarter of middle schoolers have considered suicide, and I have dealt with my peers dealing with those thoughts, and I've even had one commit suicide. And I don't think we can afford to wait for a total breakdown of these issues before we offer them any help. And I think this bill focuses on the window of ages 10 to 19 and community-based early intervention. And I think that addressing the trauma before it turns into substance abuse or long-term disabilities is something we need to focus on. And I think this is a proactive investment for Hawaii's future. And please pass HB 1537. Mahalo for the opportunity to testify.
Thank you. That's everybody who indicated they would be joining us today. Also testimony and support from the State Council on Mental Health, 3 organizations and 5 individuals. Is there anybody else in the room wishing to testify? Anybody on Zoom?
Members, any questions on this measure?
Oh.
Yeah, Repartio.
Chair, for Department of Health, we have Dr. Akero.
Yes, hello.
Hi, thank you. I just wanted to make sure that we're all on the same page in terms of adolescents. Like, could you let us know exactly what ages that will cover should this bill pass?
Sure. So the Child and Adolescent Mental Health Division, we serve really ages 3 through 21, and except for our first episode psychosis program, which goes through age 24. But we're working closely with our partners who also serve adolescents, Department of Education, Alcohol and Drug Abuse Division, Family Health Services Division, Office of Youth Services, Injury Prevention Branch, which is the seat of our suicide prevention activities. So it would be in that age range, but I'm proposing a coordinated, through 21, and I'm proposing a coordinated approach across the different child serving agencies. Several people have noted that the system, while I think we provide a lot to support adolescents. It can be sometimes siloed or fragmented because of the way it's organized. So across those adolescent serving agencies, I think we would want to come together to agree on the most impactful programming for adolescents.
I'm sorry, so to clarify, if passed as is, this bill could cover ages 3 to 21. However, the department would work with the community agencies to determine what ages would fit into the adolescent needs. Did I get that correct?
Yeah, so when we yes, sorry, I know it's I wasn't very clear. So when we go through the competitive procurement process, as we start to define scope for community programming, when we do our request for information, oftentimes we'll learn from the providers who are providing services, what age ranges should be targeted for specific services, for example. So I think if we do get an appropriation to provide community-based preventive services, we're going to listen to the provider agencies through that RFI process to build scope that's kind of targeted and impactful for the age range that those services are built for. So without having gone through that process, I don't want to say, that we're going to include or exclude any particular group of adolescents. I think what we'll learn through the competitive procurement process is how to tailor services as effectively as possible.
Thank you so much. That was very helpful. Thank you.
Thank you.
Thank
Members,
you.
any additional questions? Seeing none, we're gonna move on to HB 1541, HD2, relating to the Department of Health.
We have the Department of Health in support.
Imatsu, DOH, we stand on our testimony and support.
Thank you. And HGA in opposition.
HGA will stand on its testimony in opposition. Thank you.
That's everyone. That's all the testimony we've received on this measure. Anybody else in the room wishing to testify? Anybody on Zoom?
Additional questions on this measure? Seeing none, we're gonna move on to HB 1562, HD1 relating to youth mental health.
Okay, Department of Health and Support on Zoom.
Good morning, Chair, Vice Chair, and committee members. I'm Kaylee Aquaro. I'm the Administrator for the Child and Adolescent Mental Health Division, testifying in support on behalf of the Department of Health. We stand on our written testimony and I'm available for questions. Thank you.
I have the Hawaii State LGBTQ+ Commission in support on Zoom.
Aloha again, Michael Gloria Jr., Vice Chair of the Hawaii State LGBTQ+ Commission, he, him pronouns. We stand in strong support of this measure. Like I said earlier, access to mental health is long overdue for our, especially, we need to destigmatize it. We need to be able to meet the kids where they're at, and it's online. This would be a great way. We know it's a pilot project, but if our community is left out at the inception, we tend to be forgotten when it comes to talking about Mahu LGBTQI plus cutie pie community. We realize you probably will not amend this this bill to specifically include our community in this, but we do hope you will continue the practice that was started in the previous committee by listing it in the committee report to ensure that when this project is if this project should come to fruition, which we hope it does, that we are part of the DNA of this program. And so that we are woven into it to making sure that the needs of our community and other minority communities are served, because they each have different needs and they need to be looked at it from a different perspective and lens. We encourage you to pass this bill. We encourage you to make this happen, and we look forward to this no longer being a pilot project in the near future, but a permanent part of this program. So thank you, and available for questions. Mahalo.
Thank you. Hawaii Public Health Institute in support.
Good morning, Chair, Vice Chair, and committee members. I'm Chris Coughlin from Hawaii Public Health Institute. We're in support of this measure because mental health is essential to public health. And just to put some data behind the amazing testimony that you've heard today, there 1 in 3 public school students in grades 6 to 12 are facing mental health challenges, yet less than 25% of those are able to receive care, a number that drops to less than 20% just for high school students. And there's research that shows that over 26% of students in grades 6 to 8 have seriously considered attempting suicide. Youth are digital natives. This is going to be a digital platform, so we think this makes sense. We just wanted to note that in some states, like Louisiana and Washington, there's already efforts being made around programs like this to ensure that Medicaid programs can provide coverage determination processes to make sure that digital mental health tools are fully incorporated. So we think this is a great idea. We'd love to see it move forward. Thank you so much.
Thank you. That's everybody who indicated they would be joining us. Also testimony with comments from the State Procurement Office and 1 organization, as well as support from the State Council on Mental Health, 5 organizations and 2 individuals. Is there anybody else in the room wishing to testify? Anybody on Zoom?
Members, any questions on this measure? Seeing none, we're gonna move on to HB 1574, HD1 relating to the Healthcare Education Loan Repayment Program.
We have the University of Hawaii in support on Zoom. Oh, in person.
Actually, hi, Kelly with the University of Hawaii. I stand on our testimony and strong support.
Thank you. State Health Planning and Development Agency, SHPTA, in support.
We stand on our testimony, Chair, Vice Chair, and members, Jack Lewin. And we think this has been an extremely successful program, nearly 1,000 participants. I'd like to see it continue. It's very important. Thank you.
Thank you. We have Navian Hawaii in support. Not present. The Hawaii affiliate of the American College of Nurse Midwives in support on Zoom.
Aloha, my name is Margaret Reagan. I'm the legislative contact for the Hawaii affiliate of the American College of Nurse Midwives. We stand on our testimony. I would like to additionally discuss the practice environment for graduates, for midwifery graduates. We appreciate the fact that midwives have been named as potential recipients of these loan opportunities. Post-graduation in Hawaii, there are no residency programs for fellows. There are such programs for nurses, there are such programs for MDs, but for the Hawaii graduates, there is not an opportunity to go from school directly into a full scope practice. Hospitals do not hire in Hawaii recent graduates. This is a barrier. I don't know how it can be addressed through an amendment, but I do want to bring it into the attention of all who are involved in this loan project because it's a wonderful opportunity and we do have a chronic provider shortage and midwives could be a part of the solution. They are on all islands and working in all environments. The other barrier, though proposed, that could be addressed is the requirement of a 30% clientele that is receiving public insurance that has not been addressed in this bill. There are a number of private practice midwives across the state who provide care, but for a number of reasons, they are not providing it to 30%. So recent graduates potentially could be employed with one of these private practices, or even larger institutions such as Kaiser do not accept Medicaid. So though there may be jobs available, it would prohibit these midwives. We hope you will consider, and I'm available for any questions. The final comment, I guess I would say, is the fiscal implication of including these midwives is small. We're talking about a few very key providers who potentially are from Hawaii who could stay and serve their communities. So I genuinely hope you'll consider this recommendation. Mahalo.
Thank you. We have Otia Midwifery and Wellness and Support on Zoom.
So I have to be careful. Sorry, one moment. My name is Margaret Reagan. I have to be careful because I wear a number of different hats. I testify on behalf of a private practice, Ohia Midwifery and Wellness, and as the founder of what will hopefully be the first nonprofit licensed freestanding birthing facility on the island of Hawaii, Lehua Community Birth Center. I am speaking on behalf of all three credentials of midwives, as they will all be employed, and I currently contract with all three credentials through my private practice at Ohia Midwifery and Wellness. I stand by our written testimony, and the only part that I would like to reiterate is that there are currently 21 locations that are employing APRN CNMs. None of these locations yet are available to, of the institutions are available to employ CMLMs as they need to be added to bylaws, but we are actively working on that. A number of these sites potentially could hire Hawaii-based students, but it's all in process and it will take years. The CPMs that are working across the state are generally all in private practice, and I contract with some of them. No one is currently able to take Medicaid, though the majority of them are capable of hiring a new grad. And so we really hope that you will consider the benefit of some kind of an adjustment to the 30% public insurance requirement of the loan. I don't know how that could be addressed in this bill, but I did try to reach out to the chair to discuss prior to hearing. Thank you for considering our suggestion. Mahalo.
Thank you. That's everyone who indicated they'd be joining us. Also testimony and support from the Office of the Governor, the Office of Hawaiian Affairs, and 9 other organizations. Is there anybody else in the room wishing to testify? Anybody on Zoom?
No. Members, questions on this measure? Seeing none, we're gonna move on to HB 1591, HD1 relating to healthcare.
We have the University of Hawaii in support on Zoom. Oh, University of Hawaii.
Stand on support, but I think Laura Reichart was maybe gonna testify.
Oh.
But we're all supportive.
Okay, Department of Taxation with comments.
Still text stands on our written comments.
Thank you. DCCA Board of Nursing in support.
Thank you, Chair. The board will stand on its testimony.
Thank you. Hawaii State Commission on the Status of Women in support.
Yes, good morning, everyone. I stand on my written testimony in support. Thank you for your consideration.
Thank you. Hawaii Public Health Institute in support.
Chris Coughlin from the Hawaii Public Health Institute, we're very much in support of this measure as well. As you're all very well aware, there's a massive doctor shortage in the state of Hawaii that's grown to over 800 positions, and on Hawaii Island, which is the most acute, Hawaii Island would have to grow its physician supply by 43% to meet demand. Maui's just behind that at 35%. And this program, when it was originally evaluated, showed that there was a 77% increase in active preceptors, which is phenomenal in terms of its effectiveness. We're particularly interested in this because it includes social workers, and we talk about the doctor shortage and medical professional shortage a lot. We don't often talk about social workers as much, but there was a report that came out from UH's Thompson School of Social Work that showed the demand for healthcare social workers in Hawaii is going to grow by 18% over the next decade, and for specifically mental health and substance abuse social workers by 22%, which is a big need in our population as well, and one that we often work with at Hi-Fi. So we're in strong support of this, and we are hopeful that it moves forward this year. Thank you so much.
Thank you. We have Tax Foundation of Hawaii with comments on Zoom.
Thank you, Chair, Vice Chair, members of the committee. Tom Yamachika from Tax Foundation. We had some very short comments and we'll stand on those. And we'll be happy to answer any questions.
Thank you. Hawaii Academy of PAs in support on Zoom.
Hi, good morning. We stand on our testimony. We'd like to add that the importance of the preceptor tax credit is ultimately to support healthcare and workforce development. To date, PAs have not been included in this preceptor tax credit, but we now have PA students from Hawaii who are attending Hawaii-based institutions for PA school, and it's important that we support these students so that they can have clinical education experiences in Hawaii and ultimately stay in Hawaii.
Thank you. Kaiser Permanente in support. Not present. Ohia Midwifery and the Wellness and Lehua Community Birth Center in support on Zoom.
Aloha, thank you for this opportunity to testify. I speak on behalf of a private practice and a developing birth center. We stand by our testimony. I want to reiterate that the benefit of consideration of the addition of a clause that has been utilized in SB 2491, the landmark bill that revised statutes regarding healthcare to use provider neutral language where applicable. We, just as the previous testifier for PAs, we wish that midwives could be included. There was a clause in that massive bill, which was midwives license under chapter 457J. We wish to be included in this opportunity. Even then, we also want to reiterate that there is no midwifery-based program in Hawaii. Though there are currently 70 plus midwives serving the community, and a number of them available to precept, all of their students are in remote programs. None of those programs have a 50% Hawaii student base. These programs are very familiar with the medical community. They include Frontier Nursing and Georgetown University, Thomas Jefferson University, and there is a new program starting through the University of Colorado Anschutz that has incredible rural health scholarship programs for both certified nurse midwives and certified midwives who are dedicated to serving their communities. Last year, we asked for consideration of this barrier for midwifery preceptors. It's very difficult for Hawaii-based students, number one, to enroll in a rural program, and then number two, to secure a clinical site. The clinical sites currently are Kaiser, Tripler, and Queens. During the government shutdown, I was directly in touch with student at Tripler, where they've been trying to finish their program for years, and their clinical experience kept getting interrupted by the shutdown. This student had tried to secure a place in Kaiser, had tried to secure a place in Queens, on any island. There are 3 private practice midwifery groups that also precept students. So we very much hope that you will consider it. This is very much a social justice issue. For the APRN CNMs and the CMs in Hawaii, there is only one Native Hawaiian provider. And for the CPMs, LMs, of the 40 licensed providers, there is only one who was born and raised in Hawaii. So we really hope that somehow we can address the need to grow providers from Hawaii and to support them. It's wonderful that this preceptor program is going. It seems to be very effective. I think it's important to understand that the 2 credentials of the APRN CNM and the CMLM are advanced practice credentials. They both act as primary care providers. So already they were in alignment with the first initiative, and it's wonderful that there's consideration of other credentials. Thank you so much.
Thank you.
Thank you.
Members, that's everybody who indicated they will be joining us today. Additional testimony from 18 organizations and 16 individuals. Anybody else in the room wishing to testify?
Hi, I'm sorry. I wanted to testify as an individual, outside of the UH testimony. You guys are brilliant to start the preceptor tax credit.
Sorry, can you just state your name for the record?
Sorry, Kelly Whippy. You guys are brilliant starting the preceptor tax credit program 5 years ago. We've only used half the funds allocated and less every year. And while I'm a physician and I do the physician workforce research, only physicians, nurse practitioners, and pharmacists can actually make use of this. And as you've heard, we now have way more programs. We have occupational therapy, physical therapy. We have 2 PA programs. We're just developing wonderfully in the state, and now we have some rural health transformation money that will pay tuition for these programs, and it'll pay for the travel to do rural training. So I really encourage you, it's a cheap way to get these trainings done because it'll only cost, the money's already in there, you know. If we could maximize the preceptor tax credits, I think it would go a long way to training our healthcare teams together like we need to do. Thanks.
Thank you. Anybody else in the room? Anybody on Zoom?
Members, any questions on this measure? Seeing none, we're gonna move on to HB 1853 relating to dementia.
We have the State Health Planning and Development Agency, SHPTA, in support.
Hi, Jack Lewin, SHPTA Administrator. Thank you, Chair, Vice Chair, members. We stand on our testimony and support.
Thank you. Executive Office on Aging with comments.
Morning, Chair, Vice Chair, members of the committee. My name is Caroline Cuddy-Rowe. I'm the Director of the Executive Office on Aging, and we support the intent of this bill and wanted to offer some comments. This bill requires the Executive Office on Aging to establish and operate the Hanai Memory Network. That will include hiring the project manager, the dementia care specialists, coordinate services, create the clinical partnerships, provide training, collect data, and to report back annually to the state legislature. EOA is currently leading the Hawaii Dementia Initiative, which we've done a lot of good work around. We have delivered statewide dementia education training to over 6,300 community members and 2,600 professionals. Our public awareness campaign that just wrapped up in December reached over 56 million impressions, and we've launched the Healthy Brain Tracker. And we also are trying to fulfill the mandate of Act 286 from last legislative session, which requires us to collect data on early initiatives around dementia. And despite all of these accomplishments, we're currently at capacity. I have a lot of staff vacancies, and despite all of this, we just ask that either we are allowed additional time to implement this project, or looking at a time when both our infrastructure and the state's economy is in a better position to launch this project. But on a personal note, my dad had dementia. He since passed a few months ago. My mom just started adult daycare this past week because she has dementia also. So this is personal too, but just wanting to taking off my director's hat and just saying this is a good project, just maybe the timing. And I'm available for any questions. Thank you.
Thank you. Alzheimer's Association Hawaii in support.
Aloha Chair Todd, Vice Chair Tsukanuchi, and members of the committee. I'm Kobe Chalk with the Alzheimer's Association, and we're in strong support of this bill. This bill is a cost-saving measure. The Alzheimer's Association has been fighting for decades against this disease, and the state has too, but we've been fighting it on the back end as a state. As of 2020, the annual spend on Medicaid for people living with Alzheimer's and dementia was about $240 million a year. As of 2025, the number was up to $309 million per year. So it's a $69 million increase. And we're expecting that number to double over the next 25 years. At this pace, our state's gonna be paying nearly $1 billion in Medicaid costs for people living with Alzheimer's disease if we don't do anything. New treatments and advancements in medicine now allow earlier detection and, very excitingly, treatment. These treatments slow down the progression of the disease significantly. But aside from just slowing down the disease, creating a care plan also benefits both people's pockets as well as their ability to work and support their families. The measure that you have would establish a memory clinic on the neighbor islands where support is needed the most. When someone is diagnosed with the disease, they need to make it to a specialist. About 40% of PCPs weren't trained on dementia care, and about 60% weren't trained on or aren't comfortable making a diagnosis. So it's important that people have access to specialty care to receive these treatments so that this is equitable for the entire state. We kindly ask for your support in moving this bill forward so that we can continue to help people in the state access treatment earlier and bring the cost of this disease down. Thank you.
Thank you. That's everybody who indicated they'd be joining us. Also testimony and support from the Disability and Communication Access Board, 4 organizations and 18 individuals. Anybody else in the room wishing to testify? Anybody on Zoom? Oh.
Chair.
Yes, yeah, just state your name and stand for the record and you can proceed.
Good morning, Chair, Vice Chair, this is committee member, this is Kai Swan. I'm being strong written testimony to support this bill. And please let me a question. I'm taking a lot to testify. Sorry for being late, Chair.
Okay, thank you. Anybody else on Zoom?
Okay, members, any questions on this measure? Seeing none, moving on to HB 1854, HD1 related to community behavioral health clinics.
We have Shipta in support. Not present. And HGA in opposition.
Chair, HGA stands on its testimony in opposition. It's just limited to the civil service exemption language. Thank you.
Thank you. Members, also testimony, that's everyone who indicated they'd be joining us. Also testimony and support from the Hawaii State Council on Mental Health. Is there anybody else in the room wishing to testify?
Members, any questions? Oh, sorry, my bad.
I thought did you not receive our written testimony? DOH in support? 1854?
Sorry. I skipped. Oh, I read it wrong. Sorry. Yes, it is you guys.
Would you like to stand on our written testimony?
Thank you. Okay, yeah. Anybody else in the room wishing to testify? Anybody on Zoom?
Thank you, members. Any questions? No, we're gonna move on to HB 1871, HD1 relating to health.
Department of Health with comments.
stand on our testimony provided.
Thank you. Hawaii State Commission on the Status of Women in support.
Yes, maintaining for the Commission on the Status of Women, we stand on our written testimony in support of this measure and appreciate the committee's consideration. Thank you very much.
Thank you. The Hawaii affiliate of the American College of Nurse Midwives in support on Zoom.
Aloha, my name is Margaret Reagan. I am the Hawaii affiliate of the American College of Nurse Midwives Legislative Contact. We stand in strong support of the intent of this bill. We stand by our testimony and want to reiterate when the state is considering a pilot project regarding prenatal and postpartum care, we would hope the state would consider including midwives in that project. So please consider naming from the affiliate, we represent APRN CNMs, so advanced practice, registered nurse, certified nurse midwives, and the other credential is a certified midwife, licensed midwife. They are advanced credentials. And additionally, there is another credential of a midwife that could be engaged. It makes very good sense. We are regularly dealing with seeing clients with hypertension and diabetes or gestational diabetes. We do follow-up. It makes complete sense to include us. So please consider including us within the healthcare provider definition and the remote monitoring clinical care team. Mahalo for your time. Suggested amendments have been provided in our written testimony.
Okay, thank you. That's everyone indicating they'd be joining us. Also, testimony and support from one other organization and one individual. Anybody else in the room wishing to testify?
Hi, I'm Brian Vick here on behalf of Acting Executive Director Christine Pagano and the Disability Education Access Board. We are in support of this bill. You know that these diseases can have an impact also not only on the moms but also potentially on the children. So we would urge you to pass this. Thank you.
Thank you. Anybody else in the room? Anybody on Zoom?
Chair.
Oh, we got one.
This is Addis Kwan. I stand in written testimony support.
Thank you. Anybody else on Zoom?
Members, any questions? No. HB 1965 HD1 relating to primary care.
We have Shipta in support.
Good morning, Chair Todd, Vice Chair Takanuchi, and honorable members. SHPTA did not propose this bill. Its companion bill 2690 was identical. It proposes to increase financing for primary care in Hawaii. And I feel the need to discuss the comments. We didn't propose it, but hundreds of clinicians, JABSON faculty members, health centers, and patients reported the need for us to put some attention on primary care in this state. We're sad that the original purpose of the bill didn't proceed. It was to expand the funding from what we estimate right now is 3 to 4% for a lot of insurance. And there's so much misinformation about how much we're investing in primary care. We're calling primary care urgent care clinics, which are not continuity of care. We're calling primary care a bunch of other things, contracts and so forth. We're really not spending enough money here. The federal government that offered the AHEAD grant to this state specifically said we need to increase primary care funding in our state from their data to at least 12% over the course of the AHEAD grant. So there's just a lot of misinformation. Insurance companies have different views of what they're spending. Some are doing better than others, but this is really important because we got to think about this in terms of just the rest of the world and our country. If we look at the OECD nations in the world, there's 38 of them. We're the only one that we're spending 17% of our GDP. The rest of these 37 are paying 7% on average. We have poorer health outcomes than all the other 37 nations. They have greater longevity, better cancer, better heart disease outcomes. And so we've got to look at what's the cause. And a lot of it really is just the absence of primary care to screen the early parts of illness in the beginning. I don't wanna go on too long about this, but I think that in this bill, we kind of pushed away the original intent to get up to 12% over years, and we have a working group, which is really saddening, I think, to the people that proposed this. We'll make that working group dynamic. We'll come back with data next year. We're asking only for $100,000 though to help us, because we're gonna need some data acquisition and a part-time person to help us with that. And we really think that this will make a big difference in not only improving population health in Hawaii, but actually reducing healthcare costs over the long run significantly. So thank you for hearing the bill, and we'll be back next year. Thank you.
Thank you. Hawaii Association of Health Plans with comments.
Aloha Chair, Vice Chair, members of the committee, Rachel Wilkinson on behalf of the Hawaii Association of Health Plans, and we stand on our written testimony providing comments.
Thank you. HMSA in support.
Good morning, Chair, Vice Chair, members of the committee. I'm Moani Ray-Ben, also with HMSA. We're here in support today of House Bill 1965. This is a very important issue and yet very complex, and so we very much so appreciate the previous committee's approach to establishing a primary care working group, which ensures that all stakeholders are together at the table with a voice to have a better collaboration and to provide a meaningful recommendation next year. Thank you very much.
Thank you. Hawaii Healthcare Task Force in support.
Good morning, this is Scott Grosbright. I'm a breast cancer specialist and president of the Hawaii Healthcare Task Force. I'd like to thank the committee for hearing this bill. Many of the healthcare heroes who provided primary care during the COVID pandemic are now on the verge of fiscal insolvency. Only about 3.6% of Hawaii's healthcare funding from CMS is being used to pay primary care providers who provide about 80% of the healthcare visits in Hawaii. This is extraordinarily short-sighted as adequately funding primary care would lower global healthcare costs and improve patient outcomes. Our research shows that the Hawaii insurance companies are spending about $100 million annually on third-party contractors who are mostly on the mainland and provide no patient care. There are many states that are passing laws, enforcing regulatory targets, or issuing executive orders to force insurance companies to adequately fund primary care. It would be Pono for all Hawaii insurance companies to publicly pledge to fund primary care at 6% by January 2027, and the Hawaii Healthcare Task Force calls upon our insurance industry to do so. It's illogical for insurance companies to argue that this cannot be done in Hawaii. It's already happening in many other states in the entire continent of Europe. Another major regulatory challenge that we have is that there are 6 state laws and 3 federal laws that require DHS to report key performance indicators such as primary care spending. But when the task force requested report 601, which documents primary care spending from DHS, there was no primary care spending reported. It was a blank report. How can Hawaii enforce adequate funding of primary care unless we keep track of it? And thus, I echo Dr. Lewin's request to get some adequate funding for SHPTA to carry on this important research. We ask that the committee pass this bill and also recommend that our insurance company fund primary care adequately so we do not lose more primary care clinics. This is so critical. We're so short of providers, and thank you for your time this morning.
Thank you. That's everyone indicating they'd be joining us today. Also testimony and support from 7 organizations and 8 individuals. Anybody else in the room wishing to testify?
Chair.
Anybody on Zoom? Go ahead.
Chair. Good morning, Chair, Vice Chair, committee members. I'm Kai Swan. I'm strong support of this bill because healthcare provider is most important in the community setting. And I have a Medicaid provider, so I go doctor every day. I doctor Kapilani Medical Center for Women and Children to check on my eyes. I go to the dentist and check on my teeth, and I go to my primary doctors at the Queens Urgent Care. They call it Empower Health. It's about like 10-minute walk from my house to the facility. So I'm pretty proud to support this bill, and please pass this bill in the future so that we can get this show going. And they cannot testify, and please let me know big questions. Sorry for being late.
No, thank you. Anybody else on Zoom?
All right, thank you. Members, any questions on this measure? Rep Kush?
Thank you, Chair. HMSA. Thanks for coming out. You know that Dr. Grosskreutz pointed out some figures, and so did Dr. Lewin. What do you think? Because it seems externally
that it would be in both the insurers and the industry's best interest to support primary care providers. And, I can viscerally see their decreasing numbers. Is it not in HMSA as the largest insurer's best interest to kind of see the longevity in the industry, or I'd just like to hear your perspective on that.
Oh, no, we absolutely agree. Primary care is a critical and foundational component of our healthcare system. We believe definitely in investing in our primary care network and all of our providers. I think, as Dr. Lewin had also pointed out previously, it's just very complex. As we look at how do you define primary care, there was a lot of complexities, I think, in the original bill. We would very much so appreciate the effort of this working committee to be able to sit together and develop the plan of how do we better invest and really look at the numbers across the board.
Okay, so you think that this bill would help kind of provide a pathway forward to support primary care providers, and obviously I know the intent of the original bill is to give them better reimbursement rates instead of directing some of that money to third party, I don't know, I'm gonna use the wrong word, I'm sure there's an industry word for people who make decisions about pre-authorizations and stuff along that line. Do you think it will lead to a better outcome from our primary care providers?
I think together with the working group, yes, that in the end we will come to a conclusion that is going to be in the best interest of our community as a whole. Because we're not looking at, just reimbursement. We want to ensure that there's quality of care, that there's future investment into our community. And so again, I think the working group is the best approach forward because we are going to have everyone together to understand all sides of the perspective.
Okay, thank you, Chair. Thank you.
Thank you.
Thank you, members. Anything additional? Seeing none, we're gonna move on to HB 1966, HD1, relating to the Emergency Medical Services Special Fund.
We have the Department of Health and Support. Thank you. Tax Foundation of Hawaii with comments on Zoom.
Thank you, Chair, Vice Chair, members of the committee. Tom Yamachika from Tax Foundation. We think this bill is good. It aligns the revenue source better with what the special fund is, but we think that concomitantly with that, we should get rid of the earmarks on the vehicle reg fee and the tobacco tax because those have no nexus with emergency services in our view. Thank you for allowing me to speak. I'm happy to answer any questions.
Thank you. We have Laura Mallory Sayre in support on Zoom.
Good morning, Chairman Todd and Vice Chair Takanaguchi, committee members. My name is Laura Mallory Sayre. I am the co-founder of the Daniel R. Sayre Memorial Foundation, and for the past 28 years, I have served as the executive director of this nonprofit, which provides life-saving equipment and training for our fire department personnel. Through default, I have become a bit of an expert on the difficulties surrounding the acquisition of emergency equipment to meet the needs of our first responders, particularly by the state and the counties due to the lack of funding and the onerous procurement processes that are currently mandated. I'm speaking to you today to urge you to modernize the Emergency Medical Services Special Fund to allow adequate funding for necessary medical vehicles and training to be made available immediately by exempting the procurement process for this department for these needs. It often takes up to 2 years or more to simply apply for these needs through the existing procurement process. And then you need to add on to that time frame the backload of vehicles available nationally, which can add on to another 3 or 4 years. If we're going to be truly responsive as a state, we need to be able to order needed vehicles immediately to serve our communities. Technology has changed significantly since 1984, when the statutes, rules, and regulations governing the department were last examined. We need to be proactive instead of reactive when there are lives at stake. This means that our first responders should be provided with the very best equipment and training that is available. I urge you to pass this bill and to exempt the DOH Emergency Medical Services Department with the exception of the existing procurement process. Our needs on the Big Island are extremely dire, and we don't have enough ambulances. And when one does break down, we can't get another one quickly. We don't have the support for the personnel to add on new ambulances. And it sometimes takes an hour and a half in one direction to get to people who need EMS care. And then another hour and a half back. When minutes count, this is critical. So I urge you to support the Emergency Medical Advisory Report and to get those procurement processes eliminated for them. We need to get our equipment quickly. And I really appreciate the time today. I apologize for being late with my written testimony. I know those of you who are on the committee from the Big Island know exactly what we're talking about. I appreciate it. Thank you for your time.
Thank you. That's everybody who indicated they would be joining us today. Also, testimony with comments from the State Procurement Office. Anybody else in the room wishing to testify?
Chair. Good morning, Chair, committee member. This is Kai Swan. I'm a big supporter of this bill because emergency services vehicles is most important. The last testifier was saying, because if one vehicle breaks down, it ruins the whole 911 emergency response. So can you please pass this bill and please get this bill forward and decline testified, and please let me have any question.
Thank you. Anybody else on Zoom?
Members, any questions on this measure? Seeing none, we're gonna move on to the next item, HB 1969, HD2 relating to colorectal cancer.
I have the Department of Human Services with comments on Zoom.
Aloha, Chair, Vice Chair, members of the committee, Meredith Nichols, on behalf of Department of Human Services, and we'll stand on our testimony. Mahalo.
Thank you. We have DCCA Insurance Division with comments.
Morning, Chair, Vice Chair, members of the committee. I'm Justin Chu from the Insurance Division. Stand on our written testimony providing comments.
Thank you. American Cancer Society Cancer Action Network in support.
Thank you, Chair, Vice Chairs, and committee members. Cynthia Au on behalf of the American Cancer Society Cancer Action Network, and we testify in strong support of this measure. Mahalo for considering this bill. Cost remains one of the most significant barriers to preventive cancer screening. Uninsured adults are far more likely to get diagnosed in late stages when treatment is more complex and expensive and less effective. For colorectal cancer, late stage diagnoses often cost over $100,000. As Hawaii anticipates the increase in uninsured adults with changes in access to Medicaid coverage beginning at the end of this year, this public assistance program becomes even more critical to ensure access to preventive screenings. We respectfully urge the committee to consider this as a dedicated funding for early cancer prevention for uninsured adults. And no one in our community should forego life-saving access because of costs of concerns or lack of insurance. Thank you. I'm available for questions.
Thank you. That's everyone who indicated they would be joining us. Also comments from the Department of Health and testimony and support from 5 organizations and 13 individuals. Oh.
Chair.
Vice Chair. Sorry, Kylie, can you hold on? We have someone in the room.
That's me, Chair. This is Kai Swan. I'm in strong support of this bill. My video, hold on.
Okay, thank you. Sorry.
I'm strong support, sorry.
Okay, thank you.
Good morning, Vice Chair Takanochi and Chair Chris Todd and members of the committee. I'm Lola Irvin representing the Department of Health. So the Department of Health offers comments on HB 1969, HD2. We really promote early detection. And so in order to do that and to help people achieve optimal health and long years of life, I like to say we like to have people start with a twinkle in their eye and end with a twinkle in their eye, having lived a good long life. We are putting on a Get Screened Hawaii colorectal cancer screening campaign that'll start March 1st. So you'll see it Monday and it'll go through June 30th. And it's because our screening standards have changed. So people age 45 should start to get screened for colorectal cancer. And what we know in the US is it is the leading cause of death for people under age 50. And so early screening and regular screening is very important to extend those quality years of life. I do have some 2024 data. And so for our age group, 45 to 54 years of age, only 53% reported getting screened. And for those that are 55 to 64 years old, 76%, and 65 to 75 years old, 80%. So it looks like our retirement years are really good for screening. But for those who are working, they need our encouragement. And for those who are uninsured, 29% who are uninsured said they did not meet the screening standards. So we offer these comments and thank you for hearing HB 1969.
Thank you. Anybody else in the room wishing to testify? Please come forward. You can just state your name and position for the record before you start.
Thank you, Chairman Todd and Vice Chair, members of the committee. My name is Linda Asato, and I'm in strong support of this bill. My grandfather died of colorectal cancer, three of my uncles and my auntie. And I'm very aware of the need to have colonoscopies when I have such a strong family history. And I totally support this bill for those who are underinsured and not insured. Thank you for listening.
Thank you. Anybody else in the room? Anybody else on Zoom?
Chair, Vice Chair, honorable members, we didn't support the testimony on this because we realized that others in the Department of Health were going to come in with strong testimony, but we strongly support this bill. Thank you.
Thank you.
Chair. Good morning, Chair, Vice Chair, committee member. I'm written strong support of this bill. Thank you for allowing me to testify.
Thank you.
Members, anything? Any questions? If not, we're gonna move on to HB 1973, HD1 relating to health.
First we have Shipta in support.
Yes, strong support. Strong 973. I'm sorry. Yeah. I was lost in my package here, but this is good. Okay. Chair, Vice Chair. Yes, this is Kapuna Caucus. I would appreciate just being able to make comments. The Kapuna Caucus idea, the Kapuna Aloha idea came out of our advisory council on Kupuna at SHPTA. The idea is to address that population of Kupuna who do not have home care service access. And that's frankly the traditional Medicare beneficiaries. If you're eligible for Medicaid, you have access to transportation services, food support, and many other support services, including home health. If you are a Medicare beneficiary in traditional Medicare, you do not have home health services. This bill would provide, in a very inexpensive way, for less than $1,000 a beneficiary per year, the ability to have somebody visit the person at home, connect back to the primary care doctor, and monitor the patient's health and well-being. Where community health workers are available, we'll be using them. We're not, and we have nowhere near enough community health workers to meet this need. There's probably 25 to 30,000 very frail seniors who need this kind of support, and there's no services available. Where those people aren't available, we're going to use volunteers. We have programs like Project Dana, Hui Haua, and others that already are doing this kind of work with no reimbursement or support whatsoever. So we're going to expand. We've talked to a number of churches and community associations and clubs who are willing to come up with 1 or 2 volunteers for their immediate neighborhood. So this is a real inefficient way. All we need to do is to fund some training, some vetting for the people that come in, a bit of support for them, give them an iPad, and allow them to go out and see their beneficiary in their neighborhood, and then report back in as to how they're doing. We know this is going to reduce hospitalizations, emergency department visits, state costs, because we pay for some of these services in indirect ways. And Medicare doesn't cover a lot of these benefits. So this is an important area to go. Half of the money for the request for this is coming out of rural health transformation for our neighbor islands. But this request in this bill allows us to put $2 million toward providing 500 to 1,000 beneficiaries in urban Honolulu, where most of the people are actually going to be. So so we're dual funding it, rural health for the neighbor islands and this program for Oahu. Please support this bill. Thank you very much.
Thank you. Executive Office on Aging with comments.
Executive Office on Aging will stand on our comments. Thank you.
Thank you. That's everybody who indicated they'd be joining us. Also testimony and support from the
There.
Disability and Communication Access Board. 1 second, Kylie, I'm finishing up the written testimony. Testimony and support from the Disability and Communication Access Board, 2 organizations and 4 individuals. Anybody else wishing to testify? Okay, go ahead, Kylie. State your name and position and go ahead.
Good morning, Chair, Vice Chair, committee members. My name is Kai Swan. I'm in the strongly written testimony and support. Decline to testify, Chair.
Thank you. Anybody else wishing to testify?
Alright, thank you. Members, any questions? Yeah, Hartsfield?
Chair for Shipta. Dr. Lewin, the bill proposes the pilot program to cease to exist on June 30th, 2027. So my question is that sufficient time to determine whether or not this pilot project is effective and needed, or should the length of the pilot project be extended?
Thank you for that question, Representative Hartsfield. It really isn't long enough. And we will have to come back and show that it's working. It's gonna take 6 months or so to just get started with the program. There is a home health agency that's willing to right now start the program by doing a complete assessment on anyone that's referred. The primary care doctor or clinic can refer people in, but it'll take a while to set it up. This was one of the measures the Kupuna Caucus, your own Kupuna Caucus has strongly recommended. But we would have liked it to be at least a minimum of a 2-year pilot project. And we certainly would still approve that. I'd be happy to implement it if you could do that. Thank you.
Okay, anything additional? Yeah, go ahead.
Dr. Lewin? Sorry. Thanks. You mentioned.
Actually, it's good to get up and down.
In your testimony, you mentioned the Rural Transformation Healthcare Grant.
Yeah.
And just real quick, what is the timeline on the deployment of those dollars? I know we secured that at the tail end of last year, and we're discovering the guardrails, I think, as we speak, but I'm just trying to figure out how quickly we can fund, and then to your point, provide the right timeline to develop the measures.
Thank you for that question, Representative Caleb Kapulu-Leloy. Actually, I think we're still in negotiations with CMS on this. We have to encumber all the money for this year before September 30th. We believe we'll be getting some procurements out way before that. But we're still kind of going through negotiations back and forth. So this program, if it was funded by, and it will be, it's approved by, at least in principle, by CMS, it might not really get launched until midsummer or late summer. So it's gonna be, this one could start a little sooner if it was funded by the legislature. But the other program can be funded year after year and be expanded in future years. So actually, we should be able to for more services to neighbor islands because we have more funding available.
Okay, and then real quick, what is the timeline on the spend down for the Rural Transformative Healthcare Grant and the first tranche of money?
It must be spent by the end of the next fiscal year. So that would be September 30th of 2027.
Thank you, Chair.
Thank you. Anything additional? If not, we're gonna move on to the next item, HB 1974, HD1 relating to health.
First we have Shipta in support.
Hi, I'm Jack Lewin.
Let's go.
I'm sorry that we have so many bills here, but there's a lot of important issues. I just wanted to speak about the comments. We're in support. There have been previous bills in previous years to try to address hearing loss in the state, which haven't prevailed. It's kind of a forgotten issue for a lot of folks in healthcare, but it's important. We screen a lot of our kids, but we don't even screen all of our keiki in school, and hearing loss for kids in school that isn't detected really affects their learning ability, obviously. And for adults, by the time people are 80, the majority have hearing loss, and many don't get care or therapeutic help in that area. But we also have a whole host of adults who have sudden hearing loss after viral infections and other, sometimes undetected. And this is devastating. They can't work, they can't deal with their activities of daily living in a normal way. So what we'd like to do with this money is really just assess the issue, determine what we should be thinking about in terms of a plan in the future to address hearing loss. It's an important issue and it's a forgotten one. We would hope you will support this very modest funding request.
Thank you. Executive Office on Aging with comments.
We support the Carolyn Carrera. We'll send our testimony offering comments. We support them. Thank you.
Thank you. Alzheimer's Association Hawaii in support.
Aloha Chair, Vice Chair, Kobe Chuck with the Alzheimer's Association. We're in support and will send our written testimony. Thank you.
Thank you. Here for Hope in support on Zoom. In person.
Aloha, my name is Tori Carapillo and I'm the founder of Here for Hope. I come before you both as a community advocate and as someone who has lived experience. In 2021, I experienced sudden hearing loss. I remember being told that there was nothing more they could do, that this was something that I just had to learn to live with. In that moment, I wasn't just losing my hearing, I was losing my confidence, my independence, and my ability to communicate. What made it even harder was realizing that there was no clear path forward. The diagnosis was addressed, but there was no roadmap, no coordination, no guidance, and no clear place for me to turn to for support. I also learned that hearing devices alone just don't do enough. It's education, assistive tools, and ongoing support. Those are all the things that make the difference between isolation and participation. And too many people, they just don't have the access to it. I was fortunate, but many are not. That experience led me to start Here for Hope because no one should have to navigate hearing loss in such a fragmented system. Through our work, we hear the same stories again and again. People don't know where to go. Care paths are confusing. Providers are stretched thin, and services are disconnected. Hearing loss affects far more than just hearing. It impacts communication, employment, independence, and the quality of life. And as Hawaii's population continues to age, these challenges will only grow. House Bill 1974 is an important opportunity for us to take a proactive, coordinated approach. A statewide plan would help us to identify gaps, strengthen early detection, support workforce development, and ensure community voices are part of that solution. Both through my lived experience and my work within the community, I can clearly say that the need is real, the gaps are significant, and the cost of inaction is high. Mahalo for this opportunity to testify. I respectfully ask for your support. Thank you.
So everyone who indicated they would be joining us, please note additional support from 4 organizations and 48 individuals, as well as 2 individuals providing comments. Is there anybody else wishing to testify?
Well, Chair and Vice Chair and committee members, my name is Brian Mick. I'm here on behalf of Acting Executive Director Christine Pagano and the Disability and Communication Access Board. We are in support of this bill. Tens of thousands of Hawaii residents experience loss of their hearing, and our aging demographic is only going to accelerate this trend. If left untreated or unmitigated, there are associated risks with this, such as the cognitive decline and dementia, and as you've heard, those are very expensive to treat. So if we can avoid those, that is to be done. The comprehensive plan will allow for limited resources to be optimally deployed when providing program services, auxiliary aids and treatments as appropriate. And I'm sure DCAB is looking forward to hopefully participating in the development of this plan. Thank you.
Apologies, I don't have you on the list, but if you have the written testimony and give it to the staff, we can double check, make sure it gets online.
So we didn't get it in time.
Oh, okay, thanks. Anybody else wishing to testify?
Okay, thank you, members. Any questions? Camera Parsu?
Yeah, can I have a Dr. Lewin come off? It should be an easy question to answer. So I do represent Waipahu, but there are times it feels like I'm on the neighbor island. So I have to ask about this rural healthcare grant. Would it be applicable to something like this? Could that be another source of revenue to fund this project?
It wasn't in our original, we had to put our proposal together in less than a month as a state, and the governor led the process, and he did an amazing job with it of just forcing out something that got not only the minimum we would get would be 100 million a year, but we got 189 million a year. So we got actually more money per capita than any other state in this rural health transformation piece. It's kind of a, Waiua and Mililani are kind of in a quasi zone, and can we say that they're rural? We think we can. We think we can provide resources there. For this particular program, it wasn't in our proposal. So it would have to wait until year 2 if we were able to try to insert it in. I'm sure there will be many changes in what we proposed the first year when we get around to seeing what we want to put in the second year and the subsequent years.
Thank you. And just for future reference, for our rural community representatives, that's probably something we're interested in, so you can just tell us right off the bat and then we won't ask.
Well, I think it's questionable. Kailua and Kaneohe weren't considered rural, but obviously Waimanalo is right there next door, and that's rural. So we can reach in from urban. We can place resources in areas that aren't rural if we sort of can qualify that the residents really need the service, just like people do on the neighbor islands.
Okay, thank you. Thank you, Chair.
Thank you. Anything else? If not, we're gonna move on to HB 2315 HD1 relating to state employee benefits.
Department of Health and Support.
Good morning. Good morning, Chair, Vice Chair, members. My name is Bobby Robinson. I'm the Department of Human Resources Officer at the Department of Health. We stand on our testimony, and I would just like to highlight that this is a budget neutral request.
Okay, thank you. We have HGA in support.
HGA will stand in support. Thank you.
Thank you. Also written testimony from one other organization in support, members. That's everything we've received. Anybody else in the room wishing to testify? Anybody on Zoom? Go ahead.
I'm in strong support.
Thank you.
Okay, members, any questions on this measure? If not, moving on to HB 2343 relating to veterans.
Okay, we have the State of Hawaii Department of Defense in support.
Yeah, good morning, Chair, Vice Chair, members of the committee. Brigadier General Retired Hilton Tsuyoshi, the department stands on its testimony in support and available for any questions.
Thank you. HHSC Oahu region with comments on Zoom.
Good morning, Chair, Vice Chair, committee members. The Oahu region will stand on our written comments, available for any questions.
Thank you. Hawaii Office of Veterans Services in support. Oh, they did not. They would be here. Thomas Driscoll in support.
Mr. Chair, Vice Chair, honorable members, Thomas Driscoll, Retired Colonel, with Army Medical Service Corps. As an individual testimony, I stand in strong support of this bill, and I'm here for questions should you have. Thank you.
Thank you. That's everyone who indicated to be joining us. Additionally, yes, Hawaii Office of Veterans Services, one other organization, and 4 individuals all in support. Is there anybody else in the room wishing to testify? Anybody on Zoom?
Oh, we got
Haley.
written, strong support.
Okay, thank you. Anybody else on Zoom?
Any questions, members? If not, getting ahead of myself. HB 2501 HD1 relating to healthcare.
We have Shipta in support.
Good morning, Chair, Vice Chair, and members. I'd like to add a few comments to this bill. I don't know who proposed it, actually, but it's a very powerful measure for us at SHPTA. I'd just like to use 1 minute to provide a little bit of education to folks. You know, we have this massive partnership that's being proposed with our biggest insurer and a large hospital system. We have lots of chaos in our system, and the real reason for this that we don't seem to kind of all understand together is that we are so underfunded by the federal government in both Medicare and Medicaid on a per capita basis. Our Medicare beneficiaries here get about $9,000 per beneficiary. The national average is approaching $13,000. That's a 40% difference in reimbursement. And the problem is, we're similar to Wyoming and North and South Dakota and Montana and some other states that have about a little bit higher, but about where our reimbursement per capita is, but they have very low costs of living. And this Medicare under reimbursement is really putting stress on everybody. It's the primary care stress to some extent, but it's the hospital stress. Every hospital is losing money on Medicare. And then the big not so beautiful bill just added a requirement that means that Medicare reimbursement has to go back to 100% of Medicare. Our MedQuest agency was taking us up to 150% of Medicare to keep the hospitals afloat, okay, and to keep others afloat in the practice. This bill will help us quantify where we have these super high Medicare costs that we can help justify getting our rate up. We're gonna need to do an addendum to a bill. Thank you last year for giving SHPTA $250,000 to get a study done, which we're finally getting through the procurement process to get moving. So I appreciate that. The second thing is, it also wants to monitor who's uninsured. We also need this data, particularly given the HR 1 impacts on the rising numbers of uninsured. So thank you for approving this, because we think it could help us monitor where we are and help us justify to the feds the increases we need in the Medicare and Medicaid per capita reimbursement. Thank you.
Thank you. That's everyone indicating they'd be joining us. Also, testimony with comments from the Office of the Auditor, the Hawaii Health Systems Corporation, and 2 organizations. Is there anybody else in the room wishing to testify? Anybody on Zoom? Yes, just go ahead, state your name for the record and proceed.
This is Kylie Swan, Chair. I'm in very strong support because people with disabilities is most important to health, and they cannot testify. I heard the floor.
Thank you. Anybody else on Zoom?
Members, any questions? Not HB 2505 HD1 relating to assisted community treatment.
We have the Department of Health and Support.
Good morning, Chair, Vice Chair, members of the committee. My name is Courtney Monsi from Department of Health. I wanted to clarify some of the comments that we had provided. This bill we do support for assisted community treatment. The amendment that we had requested is to really address the time that it takes from the filing of a petition for assisted community treatment to the decision. So assisted community treatment is a mechanism for us to really try to maintain folks out in the community who have severe mental illness but may be non-adherent to their treatment plans. So this is a mechanism for us to get a court order to ensure that they continue the medications, they continue to go to service, get case management services, get their other types of treatment that they might need. Right now, it can take up to maybe 3 months for us to file the petition and then get a decision. And during that time period, if the person is in the hospital and they're ready for discharge, we have to discharge them, and then it might be difficult to then find the person once they're discharged to serve the orders. This would also help community hospitals too, who also can file these petitions and are under the other similar to HSH, when somebody's ready to be discharged, have to be discharged. So I understand on judiciary side the difficulties, perhaps logistically and in times where there might be a need for guardian ad items to find them and get that in place. But I do hope that people will consider the amendment that we had provided. Thank you.
Thank you. That's everybody who indicated they'd be joining us. Also comments from the judiciary and support from one organization and one individual. Is there anybody else in the room wishing to testify? Anybody on Zoom?
Members, any questions? If not, we're gonna move on to HB 1577, HD1 relating to 911 services.
Department of Health and Support.
We stand on our written testimony.
Thank you. Hawaii State Council on Developmental Disabilities and Support.
Aloha chairs, committee members, my name's Chase Silver with the Hawaii State Council on Developmental Disabilities. We'll stand on our written testimony and support. We really just want to emphasize that the point of this is to make it statewide. We already have it on Oahu, we've been using it a lot. It's also on Maui, so we just wanted to emphasize it's statewide is the point of the pilot project. Thank you so much.
Thank you. That's everyone who indicated they would be joining us. Also testimony with comments from
Chair.
One second, we're going over the written testimony. With comments from the State of Hawaii 911 Board, the County of Kauai Police Department, both those organizations with those agencies with comments, testimony and support from 3 additional organizations and 5 individuals. Is there anybody else wishing to testify? Sorry, we're gonna go to do the room first.
Chair and Vice Chair Brian Mick with the Disability and Communication Access Board, we are in support of this bill. Prior to the development of Text 911 going live in October of 2016, DCAP coordinated with the Honolulu Police Department and Emergency Management Services to educate the disability community about this option. Establishing a working group for a statewide emergency safety profile system pilot program would ensure that people with disabilities can voluntarily participate in the system by sharing their personal relevant information to the emergency responders for their immediate use when they're responding by police, fire, and ambulatory services. DCAB recognizes the value of and privacy of sensitive information, especially when someone's disclosing a disability, medical, or health condition. So the hope is that the working group can review and address cybersecurity, data retention, and deletion of profiles. Thank you for the opportunity to testify.
Thank you. Anybody else in the room? Oh.
Thank you, Carolyn Kadira with the Executive Office on Aging. I don't know how this one slipped by me, but the Executive Office on Aging stands in strong support of this measure. Thank you.
Thank you. Anybody else in the room? Anybody on Zoom?
Chair.
Yes, please state your name and proceed.
Good morning, Chair, Vice Chair, committee members. My name is Patty Swan. I'm in very strong support of this bill because I use Smart 911. It is very useful, and DD council and staff helped me how to set it up, and it's pretty good because some people with disability doesn't know how to speak to 911 operator. So this tool is very helpful. It helps a very lot and it's very useful. And this is not maybe what we have, and they cannot testify.
Thank you. Anybody else on Zoom?
Thank you. Members, any questions on this measure? If not, moving on to HB 2443, HD1 relating to disaster services.
We have the Department of the Attorney General with comments.
Good morning, Chair Todd, members of the committee, Deputy Attorney General Ryan Endo, on behalf of the Department of the Attorney General. Our comments are provided in our written testimony. I'll be available for any questions.
Thank you. We have the Hawaii State Council on Developmental Disabilities and Support.
Hello, Chair, Vice Chair, Committee members. My name is Savannah Peskin. I am the Maui Program Specialist with the Hawaii State Council on Developmental Disabilities. Here on behalf of our Executive Administrator, Danger Bartoldas, we will stand in our written testimony in strong support of HB 2443. We just wanted to emphasize that the bill's purpose is that many people do not identify as having a disability, however, they still might have an access and functional need. That could be defined as any need that you have to access the community, like refrigerated medication, a mobility issue, anything like that. So it's a lot broader of a scope than just disability. And we wanted to also say that we are in support of the previous committee's amendments, and we are also in support of the recommendation of the $200,000, which establishes the position of $100,000 and then $100,000 for programming. We will be available for any questions. Thank you guys so much.
Thank you. Members, as everyone who indicated they'd be joining us, please also note testimony in support from the Hawaii Civil Rights Commission, HIEMA, and the Office of Wellness and Resilience, as well as 4 organizations and 4 individuals. Is there anybody else in the room wishing to testify? Oh. Please.
Once again, hi Chair, Vice Chair, and committee members. Brian Mick here for Executive Director Christine Pagano and the Disability and Communication Access Board. We are in strong support of this bill. Integration specialists would ensure that the needs of individuals with disabilities and others with access to functional needs are included in all phases of emergency management, including planning, response, recovery, and mitigation. In addition, they could be deployed to disaster sites to provide technical assistance. We would note that 1 in 5 residents have a disability and may require additional support before, during, and after disasters. People with disabilities encounter disproportionate risks, including difficulty evacuating without proper support, lack of accessible transportation, barriers to receiving emergency alerts and evacuation orders and accessible formats, obstacles in accessing shelters, and barriers in receiving appropriate emergency medical care and in accessing post-disaster relief programs such as housing, food, and financial assistance. We've seen examples of all of this in the past couple of years between COVID, the Lahaina fires, and the tsunami evacuation last year. We too support, as suggested in the last committee report, that the $200,000 be reinserted into the bill with $100,000 for the position and $100,000 for programming costs.
Thank you. Anybody else in the room? Anybody on Zoom?
Chair.
Yes, go ahead.
Good morning, Chair, Vice Chair, committee members. My name is Kai Swan. I'm a very strong supporter of this bill because emergency preparedness is most important. Anyone, but including people with disabilities. And we have a program called Being Safe program for people with disability, how to train, how to prepare in case of emergency. And this program is based out of California, from Sam Durbin. So can you please let me know, please pass this bill and take my testify, please, now if you have any question you have. I yield the floor, Chair.
Thank you. Anybody else on Zoom?
Members, any questions on this measure? If not, we're gonna move on to HB 2498, HD2, relating to care homes.
Okay, we have the Department of Health in support.
Good morning, Chair, Vice Chair, and members of the committee. My name is Paula Serio. I'm the Chief for the Office of Healthcare Assurance, Department of Health. We stand on our testimony in support of this measure. Thank you.
Thank you. Executive Office on Aging with comments.
Caroline Kairau, Executive Office on Aging, offering comments. I'm available for any questions. Thank you.
Thank you. Navian Hawaii in support. Not present. That's everyone who anticipate or who identified themselves as joining us. Also testimony in support from HIEMA, 3 organizations and 2 individuals. Is there anybody else in the room wishing to testify? Anybody on Zoom?
Members, any questions on this measure? If not, we're moving on to the second to last item, HB 2581 HD2, relating to emergency management.
Okay, we have ACLU of Hawaii in support on Zoom.
Morning, Chair, Vice Chair, committee members. My name is Wookie Kim. I'm the legal director of the ACLU of Hawaii. I'll get right to the point. This bill is absolutely necessary. Emergency powers are supposed to be rare, and that's because when they're invoked, we give the executive extraordinary authority, including the power to suspend democratically enacted laws. Back in 2014, when this legislature modernized our emergency management law, The focus was clearly on things like hurricanes, wildfires, floods, disease outbreaks, not long-standing public policy challenge. But the Hawaii Supreme Court recently said an emergency can include long-standing problems that reach crisis levels. That's a major shift. And it's also a dangerous shift because once a decades-old policy issue can be labeled an emergency, emergency powers stop being exceptional. They start to look like another way to make policy unilaterally and outside of the legislative process. We're not minimizing the seriousness of the housing crisis because it's real, but so are many other serious challenges we face. And if every crisis can be declared an emergency, then emergency authority becomes the norm, not the exception. This bill draws a clear line, which is that if there's a sudden catastrophe, emergency powers are okay. But for longstanding policy, that belongs here before this body in this legislature. We ask that this committee advance HB 2581 HD2. Thank you.
Thank you. Sierra Club of Hawaii in support on Zoom. Not present. Earth Justice in support.
Aloha Chair, Vice Chair, committee members. My name is Drew Hara. I'm an Earth Justice. So we submitted written testimony in support, emphasizing the need for this bill to restore the proper constitutional balance of power between the legislature and the executive branch. We'll stand on that. I wanted to add some comments today to hopefully clarify what this bill does and does not do and address some of the concerns raised in opposition by the emergency management agencies. So under Chapter 127A, HIEMA and the County Emergency Management Authority already have a menu of existing powers that operate in any time. We don't need an emergency proclamation. And those powers are under 127A12. Those allow for things like procurement, planning, training, preparedness, making response plans, emergency planning. So these are all things that will be totally unaffected by this bill, right? So when we're looking forward, how do we best prepare, anticipate emergencies that might be coming down the road? This will not hamper HIEMA or our county agencies in any way. What this bill does affect are the additional powers under 127A13, which are the governors and the mayors in the county case, extraordinary powers, including the power to suspend any law. Those provisions are triggered under 127A14, declaration of an emergency. And so the definitions, the amended definitions in this bill are just looking to narrow the definitions of emergency in response to the Supreme Court's NACOA decision, to bring the terms emergency and disaster back in line with the original intent of the legislature. So in the county, Honolulu County DEM's testimony, they raised some concerns about language in the preamble of this bill about unprecedented size and destructiveness. Just want to point out, one, that language is in the preamble. It's not anywhere in the amended definition, so that's not raising a new legal standard. And I think more importantly, that language is actually taken directly from 127A1, which is existing language within the statute that defines the purpose and the policy of the Emergency Management Act. So to the extent that anyone is bristling at that, it's only in the preamble. If that needs to be taken out, I think that's fine. The other thing I wanted to address just really quickly, and I'll stay on for questions after, is this idea that narrowing the scope could lead to litigation in the times of emergency. Under 127A-27, there is a very comprehensive procedure outlined for how citizens can challenge an emergency proclamation. It is an expedited process that allows temporary restraining order or preliminary injunction and a ruling within a matter of days, outside of sort of the normal litigation track where, you know, there might be concerns that litigation can go on for months or years at a time. Just as an example, this is something that has played out before in the context of Governor Ige's emergency proclamation relating to Mauna Kea during the TMT protests. There was a citizen who challenged that through the 127A-27 provision. Within a matter of days, a panel of 3 circuit court judges was assembled. They were able to come out with a preliminary injunction specific to that one citizen that would allow him his constitutional traditionary and customary practices and access rights, but that left the emergency order in place broadly so that we could still continue to protect public safety. So I think some of the concerns raised by the emergency management agencies are a little bit overblown and represent kind of a misunderstanding of what this bill is actually doing. So we stand in strong support, and again, I'm here for any questions if you have any. Thank you.
Thank you. Grassroots Institute of Hawaii in support. Not present. That's everyone who indicated they would be joining us. Members also testimony in opposition from HIEMA as well as the City and County of Honolulu Department of Emergency Management. Testimony in support from 3 additional organizations and 18 individuals. Is there anybody else in the room wishing to testify? Anybody on Zoom?
Members, any questions on this measure? No? Alright. We're gonna move on to the last item on our agenda, HB 2622 HD1 relating to language access.
Shipta in support.
We stand on our written testimony and strong support. Thank you.
Thank you. Roots Reborn Maui in support on Zoom. Roots Reborn Maui. Hawaii Coalition for Immigrant Rights in support.
Aloha Chair Todd and Vice Chair Takanuchi and members of the committee. Hawaii Coalition for Immigrant Rights, we represent about 30 immigrant serving organizations across the Pai'aina. And we've been working very actively. About 2 sessions ago, we were able to work with HIEMA to get a full-time language access coordinator within HIEMA. And that was a direct result of advocacy from organizations that we worked with in Lahaina, for whom 30% of the survivors of the Maui wildfire were limited English proficient and foreign born. And so this is a part of our process in moving forward and making sure that we have both blue sky and gray sky materials ready for the various disaster scenarios that we're preparing for. For example, if we were to have like a tidal wave that hit Hau'ula, we would need to make sure that we rolled out Tongan language resources immediately, not then, find and film materials at Tongan once it's already happened. But so this funding goes towards making sure that we have those ready to go for the disaster scenarios that we think are likely. So, mahalo.
Thank you. Do we have Christine Andrews in support on Zoom?
Aloha. Thank you for the opportunity to testify. My name is Christine Andrews. I'm an attorney based in Maui, and I do want to reiterate what Liza said about the need to be properly responsive to our non-English speaking community. So in Lahaina, before the fires, about 1/3 of our residents were foreign born, and also about 36% age 5 or older spoke a language other than English at home. We have, again, large members of the Kofa community, a lot of Tongans and Philippine members of our community who are at risk during the Lahaina wildfires, and we feel it imperative that Hawaii Emergency Management Agency be responsive to the needs of our non-English speaking community in times of disaster. Thank you so much for the time.
Thank you. Circling back one more time to Roots Reborn Maui on Zoom. Okay. Anybody else in the room? Oh, that's all the written testimony we've received. Also testimony in support from HIEMA, the Hawaii Civil Rights Commission, 3 other organizations, and 14 individuals, as well as 1 individual providing comments. Is there anybody else in the room wishing to testify? Please. Just state your name and position for the record and proceed.
Aloha Chair Todd, Vice Chair and members of the committee. My name is Ana Flores. I am a fellow at the Legal Clinic. So I'm testifying on behalf of our board President Amy Akbayani, and we stand in strong support of Bill HB 2622. Many of the workers at TLC and of course the people that we serve are immigrants, ourselves included, and we draw from our experience as immigrants and from our work with those communities. We've been helping serving communities in Maui and the ones affected at the Lahaina fires and going back to the COVID-19 pandemic. So government, private companies, and nonprofit organizations need qualified personnel to provide language access, especially in times of emergency. The recent weather emergency announcements just days ago should have been available in multiple languages to ensure safety with assistance from government agencies. And strengthening language access capacity within HEMA is therefore critical to provide an effective emergency response statewide. Thank you so much for the opportunity to give these comments.
Thank you. And we do have your written testimony. Thanks. Anybody else in the room? Anybody on Zoom?
Members, any questions on this measure? If not, we're gonna recess briefly prior to decision making. Recess. Aloha, we are reconvening the House Committee on Finance for the purpose of decision-making on our 10 a.m. Friday, February 27th agenda. Again, here in room 308. First on our list is HB 816, HD1 relating to emergency response. The chair's recommendation is to move this forward as is. Are there any questions or comments? Seeing none, Vice Chair.
Voting on HB 816 HD1, recommendations to pass unamended, Chair and Vice Chair vote aye. Representative Hartsfield.
Aye.
Representative Hussey.
Aye.
Representative Keokapuli Loy. Aye. Representative Kitagawa.
Aye.
Representative Kush.
Aye, sorry.
Representative Lee is excused. Representative Miyake.
Aye.
Representative Morikawa.
Aye.
Representative Peruso.
Aye.
Representative Templo.
Aye.
Representative Yamashita.
Aye.
Representative Alcos.
Aye.
Representative Gideon.
Aye.
Representative Reyes Oda.
Aye.
Recommendations adopted.
Thank you. Next, we have HB 1535 HD1 relating to automated external defibrillators. The chair's recommendation is to move this forward amended as an HD2, including some necessary technical and clarifying amendments, and ensuring that all dates in the bill are defective. Are there any questions on this measure? Seeing none.
Okay, voting on HB 1535 HD1, recommendations to pass with amendments, noting the excused absence of Representative Lee, who will be noted as excused for the remainder of this agenda unless otherwise noted, and the presence of all other members. Are there any reservations? Any no votes? Recommendations adopted.
Thank you. Next, we have HB 1537 HD1 relating to mental health. Chair's recommendation is to move this forward as is, but I'd like some language in the committee report noting the testimony and potential expansion from the LGBTQ+ Commission. Any questions or comments? Seeing none, Vice Chair.
HB 1537 HD1, recommendations is to pass unamended. Any reservations? Any no votes? Oh, sorry. Reservations for Rep. Alcos. Any other reservations?
Sure.
And Rep. Gideon. Anybody else? Any no votes? Recommendations adopted.
Thank you. HB 1541 HD2 relating to the Department of Health. The recommendation from the chair is to move this forward as is. Any questions or comments? Rep. Russo?
I'm voting with reservations just because it provides for exemptions from civil service.
I understand, and it's something I think down the road we'll have to weigh out, kind of like where it's necessary, where it's maybe a little bit of overreach. We'll figure that out over time.
Thank you, Chair.
Thank you.
HB 1541 HD2, recommendations to pass unamended, noting reservations for Representative Peruso. Any other reservations?
Reservations.
Rep. Alcos, reservations.
Same.
Rep. Gideon, reservations. Any no votes? Recommendations adopted.
HB 1562 HD1 relating to youth mental health. Similar recommendation to 2 bills ago. The recommendation is to move forward as is, but note the testimony from the LGBTQ+ Commission. It's something a future committee can look at in the committee report. But recommendation as is. Any questions or comments? Seeing none.
HB 1562 HD1, recommendations to pass unamended. Any reservations? Any no votes? Recommendations adopted.
Moving on to HB 1574 HD1. We actually have a few substantive amendments on this measure, so the recommendation will be to move this forward as in HD2. This is relating to the Healthcare Education Loan Repayment Program. So I'll read this out so we don't mess this up. Okay, we'd like to clarify the statutory basis of the Healthcare Education Loan Repayment Program by addressing the absence of an explicit program establishment in statute and resolving potential ambiguity regarding whether existing statutory references refer to the same program. Conforming amendments will also be considered, or will be considered to ensure consistency in program naming and statutory reference. So largely just cleanup and technical things on that end. We'd also like to clarify that the applicability of the new service requirements, we'd like to clarify that by expressly specifying that the minimum service obligations apply only to healthcare professionals who receive a new loan repayment program award on or after July 1st, 2027, so that this does not have retroactive impact on the current participants. So again, another kind of technical cleanup clarification. And lastly, correct any technical drafting issues, including review of the effective date provision to ensure consistency with legislative intent and standard drafting practices. So all three are clarifying, but technical in nature to ensure that we don't mess this up. Any questions, comments? Seeing none, Vice Chair.
HB 1574 HD1, recommendations to pass with amendments. Any reservations? Any no votes? Recommendations adopted.
Thank you. Next, we have HB 1591 HD1 relating to healthcare. The chair's recommendation is to move this forward as is. Any questions or comments? Seeing none.
HB 1591 HD1, recommendations to pass unamended. Any reservations? Any no votes? Recommendations adopted.
HB 1853 HD1 relating to dementia. The chair's recommendation is to move this forward as is. Are there any questions, concerns? Okay, seeing none.
HB 1853 HD1, recommendations to pass unamended. Any reservations? Any no votes? Recommendations adopted.
Next, we have HB 1854 HD1 relating to community behavioral health clinics. The chair's recommendation will be to move this forward as is. Any questions, comments? No. Go ahead.
HB 1854 HD1, recommendations to pass unamended. Any reservations? Any no votes? Recommendations adopted.
For HB 1871 HD1 relating to health, the recommendation is to move this forward as is. Any questions? Nope.
HB 1871 HD1, recommendations to pass unamended. Any reservations? Any no votes? Recommendations adopted.
HB 1965 HD1 relating to primary care, same recommendation to move this forward as is. Any questions or comments? Seeing none.
HB 1965 HD1, recommendations to pass unamended. Any reservations? Any no votes? Recommendations adopted.
For HB 1966 HD1 relating to the Emergency Medical Services Special Fund, the recommendation is to move this forward as is. Any questions, comments? Nope.
HB 1966 HD1, recommendations to pass unamended. Any reservations? Any no votes? Recommendations adopted.
HB 1969 HD2 relating to colorectal cancer, the recommendation is to move this forward as is. Any questions or comments? Seeing none.
HB 1969 HD2, recommendations to pass unamended. Any reservations? Any no votes? Recommendations adopted.
HB 1973 HD1 relating to health, same recommendation to move this forward as is. Any questions, comments?
Comments, Chair, just I would ask the committee notes to reflect that the end date of the pilot project, if they could consider 6/30/28. Thank you.
We can do that. We'll drop some language in the committee report. I think on a lot of these things, there's some things we could probably clean up a little bit, but in the interest of not having a complete meltdown of all of our drafting agencies, some of these things we'll be sending forward with a little bit of work ahead of them, and this falls into that category.
Thank you.
But we'll note that in the committee report. So the pilot date sunset, yeah?
Yes, thank you.
Okay. Any other questions, comments? Okay, seeing none, Vice Chair.
HB 1973 HD1, recommendations to pass unamended. Any reservations? Any no votes? Recommendations adopted.
Thank you. On HB 1974 HD1 relating to health, the recommendation is to move this forward as is. Any questions or comments? Seeing none.
HB 1974 HD1, recommendations to pass unamended. Any reservations? Any no votes? Recommendations adopted.
Next, we have HB 2315 HD1 relating to state employee benefits, and the recommendation is to move this forward as is. Any questions or comments? Seeing none, Vice Chair.
HB 2315 HD1, recommendations to pass unamended. Any reservations? Any no votes? Recommendations adopted.
On HB 2343 HD1 relating to veterans, recommendation is to move it as is. Any questions or comments? Seeing none, Vice Chair.
HB 2343 HD1, recommendations to pass unamended. Any reservations? Any no votes? Recommendations adopted.
Thank you. For HB 2501 HD1 relating to healthcare, similar recommendation, if you're sensing a theme here, is to move this forward as is. Any questions, comments? No? Okay, go ahead.
HB 2501 HD1, recommendations to pass unamended. Any reservations?
Reservations.
Reservations for Rep. Alcos. Any other reservations? Any no votes? Recommendations adopted.
For HB 2505 HD1 relating to assisted community treatment, we'd like to just note in the committee report the suggested amendment from the Department of Health to reflect what may be a reasonable timeline for them. That's something that future committees may consider is what's reasonable. Any questions or comments? Seeing none, Vice Chair.
HB 2505 HD1, recommendations to pass unamended. Any reservations? Any no votes? Recommendations adopted.
Next on to HB 1577 HD1 relating to 911 services. Recommendation is to move as is. Any questions? Seeing none.
HB 1577 HD1, recommendations to pass unamended. Any reservations? Any no votes? Recommendations adopted.
Thank you. HB 2443 HD1 relating to disaster services. The recommendation is to move this as is. Any questions, comments? Clerk Hartsfield?
Comments, Chair, just note the AG's comments regarding the amended language specific to that one position.
Okay, we can do that.
Thank you.
So in the committee report, we'll just kind of reference their testimony and as something that should be considered down the road, yeah.
Thank you, Chair.
Yeah, no problem. Okay, recommendation to move as is. Any questions or comments? Seeing none, Vice Chair?
HB 2443 HD1, recommendations to pass unamended. Any reservations? Any no votes? Recommendations adopted.
Okay, on to our final page. We have HB 2498 HD2 relating to care homes. Recommendation is to move as is. Any questions or comments? Seeing none, Vice Chair?
HB 2498 HD2, recommendations to pass unamended. Any reservations? Any no votes? Recommendations adopted.
HB 2581 HD2 relating to emergency management. Same recommendation to move as is. Any questions or comments? No. Okay, thank you.
HB 2581 HD2, recommendations to pass unamended. Any reservations? Any no votes? Recommendations adopted.
Lastly, relating to language access for HB 2622 HD1. Recommendation will be to move this as is and kind of similar to the film tax credit stuff for the folks that are working on some of the immigrant rights issues. Just don't want to alarm you, this is not the only bill relevant to you folks that will be on the agenda. We have some stuff coming up next week, but I don't want to freak you out. So the plan will be to move this forward as is. Any questions, comments? No, go ahead.
HB 2622 HD1, recommendations to pass unamended. Any reservations? Any no votes? Recommendations adopted.
All right, thank you very much for your time and your patience and advocacy. We are adjourned. Aloha everyone, we're convening the House Committee on Finance. It is roughly 2 p.m. on Friday, February 27th, 2026 in conference room 308. We have a pretty full agenda. The plan for today, so everyone can kind of plan accordingly, is we will be hearing everything, but we will be deferring decision making to next week. I think most of these measures will be I think after the Monday morning agenda. Just in case people have to leave and don't want to stick around for the next couple hours, that'll be the plan. With that being said, if you are on Zoom, please stay muted until you're called upon. We will be kind of enforcing a 2-minute time limit on individual testimony, as much as possible to accommodate maximum number of bills moving through the committee as possible. Try to stand on your testimony, but if you want to provide context or if you want to really emphasize something, please feel free to do so. But just try as much to be kind of considerate of others who may be here to testify as well. Especially if you've flown in, please by all means, do your thing. And that's about it. Okay, we're gonna open up with HB 20, HD1, relating to lava zone insurance.
First we have DCCA Insurance Division in opposition.
Afternoon, Chair, Vice Chair, members of the committee, Matt Sujimura on behalf of the Insurance Division. We'll stand on our written testimony in opposition, but I do just want to point out the division's major concerns here are that it redirects funds that would otherwise go into the CRF, which is used for defrayal of costs for the division for regulatory investigation and enforcement purposes, into this subsidy fund, which would not be used to defray those costs. We also do want to point out that this subsidy program, while it would help the homeowners in lava zones 1 and 2, the division does not believe that this would actually affect in any way the affordability or the availability of insurance in lava zones 1 and 2. But with that, happy to answer any questions. Thank you.
Thank you. There was a testifier who indicated they would be joining us. Members, also testimony in opposition from 1 organization and 1 individual, as well as testimony in support by 1 organization and 18 individuals. Is there anybody else in the room wishing to testify? Anybody on Zoom?
Okay, members, any questions on this measure? Seeing none, we're gonna move on to HB 1991, HD1, relating to the liquor tax.
We have the Department of Taxation with comments.
Good afternoon, Gary Sugiluma with the Department of Taxation. The department stands on its written testimony offering comments. Thank you.
Thank you. Chamber of Commerce Hawaii in opposition.
Good afternoon, Chair, Vice Chair, members of the committee. The Chamber of Commerce stands on our testimony in opposition. Thank you.
Thank you. Tax Foundation of Hawaii with comments on Zoom.
Good afternoon, Chair, Vice Chair, members of the committee, Tom Yamachika from Tax Foundation. We'll stand on our written testimony.
Thank you. Hawaii Food Industry Association in opposition on Zoom.
Good afternoon, Chair, Vice Chair, members of the committee. I'm Alexis Chapman for HFIA. We stand on our testimony in opposition, and I'd be happy to answer any questions.
Thank you. Lani Kai Brewing Company in opposition on Zoom.
Aloha, Chair, Vice Chair. I'm Steve Humschild with Lani Kai Brewing Company. I stand on my testimony, and I just want to highlight a couple extra points real briefly. Thanks for the opportunity to testify. We understand the intent of the taxation and the structure. It just provides a massive advantage to mainland and importers and kind of punishes local businesses here. As a local producer, we already pay the top highest taxes in the nation. All of our affiliate costs like labor costs, raw goods, utility are all some of the highest in the nation. The bill as written will cost local jobs at local manufacturers, and that will favor large corporations. It's not really a question of if there will be a job loss. It'll really be to what extent that will be as this bill is written. From a structure standpoint, this bill will be the first of its kind in the nation to adapt an ABV-based system. And there's just no real clear methodology on how tolerance for alcohol, testing, standards, compliance, any of that would actually be adapted. Without large changes into the bill, it's just gonna really crush, this is an industry crusher and can destroy a lot of our local economy in favor of importers. Thank you for this opportunity.
Thank you. Lahaina Brewing Company in opposition. On Zoom. Not present. Molson Coors Beverage Company in opposition.
Alicia Thompson, on behalf of Molson Coors, we'll stand on our written testimony in opposition. I just wanted to emphasize that this bill is not just simply a restructuring, but it's a meaningful tax increase at a time where Hawaii families and small businesses are already under significant economic pressures. And for many neighborhood restaurants and bars, draft beer is one of the few items that helps keep their doors open. And nearly doubling the rate removes a long-standing differential that supports our hospitality sector. And those are small businesses and small local businesses that are in our district. So on behalf of that, I'd like to encourage you to defer this measure. Thank you.
Thank you. Hanakoa Brewing Company in opposition on Zoom.
Aloha, thanks for the opportunity to speak. Mahalo, chairs. This bill is, for us as a small business, really, really scary. We know that the tax increase hasn't happened since 1998, but frankly, we are still trying to survive. I stand by my testimony. There's a lot more there, but we work really hard to contribute to our community, and there's only so much we can do to survive, to make sure that we can put food on the plates of our employees. Like, my heart's gonna break because we just can't continue to operate as a small business this way with how expensive Hawaii already is. We have the highest electricity. We're going to have the highest minimum wage. To increase taxes yet again, and on top of that, change the structure to add a little bit of confusion and restructuring and how we pay our taxes and make sure that we are compliant. Currently, there's going to be a lot more businesses that will have to close because of this. And to those in opposition, I would gladly invite you to come in. We can have a mocktail. We don't have to drink alcohol, but there is a lot more that small craft breweries contribute to our community, and to limit it to violent crimes and all of these other things is just not fair. It's not putting accountability on the actual perpetrators of crimes, and it's a scapegoat. I heavily vote and hope that you vote in opposition. Thank you.
Thank you. Hawaii Public Health Institute in support.
Good afternoon, Chair, Vice Chair, and members of the committee. My name is Rick Collins. I'm with the Hawaii Public Health Institute. Thank you for the opportunity to provide testimony. We stand in strong support of this measure, and I just want to highlight a few things and why we think this is a win-win-win for our state. First of all, this not only contributes to a significant revenue generator for our state that's been lost over the last over a quarter century, in terms of tax revenue that has been lost due to inflation. So this helps to raise it up to inflationary standards. The second thing is that it is a tried and true public health measure to reduce the harms associated with alcohol use. The CDC says that alcohol use is the third leading preventable cause of death in our country. And the CDC also said that we spend nearly $1 billion a year in alcohol harms in our state alone. And this is one way to have alcohol pay for itself. And lastly, I was going to say one more. What was it? Oh yeah. So lastly, University of Hawaii did a study on looking at the public health impact of a dime a drink alcohol tax increase a number of years ago. And one of the things that was generated in their models was that we would actually get a net positive of 1,200 jobs. Because of the revenue generation of that. So I would encourage you to take a look at that, and thank you for letting me provide testimony.
Thank you. We have Brittany Cass in support on Zoom.
Not present.
Not present. That's everybody who indicated they would be joining us in person today. Also members' testimony in opposition from 16 other organizations and 2 individuals, testimony in support from 1 other organization and 11 individuals. Is there anybody else in the room wishing to testify?
Madam Vice Chair, yeah. Garrett Marrero, Maui Brewing, thought I had clicked the link and I'd be here. Standing on my written testimony, apologies that it's nearly 3 pages. This details the complexity of this issue that I think is unfortunately a massive lack of understanding of how this bill works. First, inflation on taxes since 1998, we were already astronomically high. Beer prices, alcohol prices in general have gone up massively since then, at least doubling since 1998. So from a GET tax perspective and other taxes that us local businesses pay, there's actually been an increase in revenues due to alcohol prices going up. I think it's completely illogical that driving the price up will continue to decrease consumption. Nobody in this room hasn't seen the articles that alcohol consumption is an all-time low. Specifically, underage drinking for the last 20 years has declined every single year. I think it's also important that this committee understands that the way this bill is currently written under HD1 gives a 90% tax decrease to the beverages that underage consumers would probably choose if they were drinking. So I think when you're talking about a case of Alcopop at $13.46 a case for tax, it does cost more than the cost to produce the case. Reduces that to $2.25 a case. So that $11.20 to me is a discount, not an increase. This will be a massive revenue driver down because many of us will be out of business. We got to keep our employees fed, we got to keep them housed. What it costs to do business here, we are paying taxes at every single level that are among the highest in the country. This bill only favors mainland production, and I argue that it's going to take us back to a world where we don't have local products on the shelves and that our choice is very, very limited. So I stand at the ready to work with you to solve the state's issues in revenue. There are ways to do this that accomplish the goals of both protecting small businesses while at the same time achieving a revenue raise by supporting those very businesses that employ the people here. I'll close with, I'm the first call when problems strike, when charities need money. All of us, you saw Chrissy earlier, Hanakoa. When the fires happened in Maui, I was the first on the west side with generators and water tankers and food and everything. When COVID hit, I was the first to make sanitizer in the state in order to give that freely. We're the first to help, and now we feel like we're being the first to be hurt. So I would ask you to defer this without significant amendments, and I'm happy to share my thoughts on how those actually impact the state. So thank you for the opportunity. I'll be here for questions. Aloha.
Thank you. And sorry, I skipped over Wine Institute in opposition. Sorry.
Good afternoon, Chair, Vice Chair, members of the Finance Committee. Mihoko Ito on behalf of the Wine Institute. I'll stand largely on the comments I've submitted in written form, but I just wanted to highlight a couple of things. First, from a national perspective, how much of an outlier this proposal is. It is taking a system, the current system that's used across the country, really it takes into account 2 factors, the alcohol by volume and the original source material that's used. So for wine, it's grapes, for example. And this is fundamentally changing that structure to only be based on alcohol by volume. It's a huge outlier. I mean, it would be the only system of its kind across the country, whether state or federal. Second, just for wine alone, this represents for Cabernet a 762% tax increase on Cabernet Sauvignons, 199% tax increase on whites, rosés, and certain red wines, and on almost an 18% tax increase on cooler beverages. So in our testimony, we put a chart, I think that's helpful to show just how dramatic this tax increase that's proposed is. And I think, at a time when we're looking at cost of living and trying to prevent cost of living increases, this is a really severe tax increase. So we just encourage the committee to rethink this proposal as it deliberates on this bill. Thank you.
Thank you. Anybody else in the room wishing to testify? Anybody on Zoom?
Hello.
Oh, hi, yes,
Hi.
please just state your name and your stance for the record and then you may proceed.
Hi, I'm Cynthia Okazaki. And I'd like to stand on my written testimony that I submitted, but I also would like to emphasize that the price of alcohol is the best prevention for preventing underage drinking. And we want to keep our youth safe, our youth and our roads safe for all people in Hawaii. So thank you, and if you have any questions, I'm open to questions. Thank you.
Thank you. Anybody else on Zoom?
Okay, members, do we have any questions on this measure? We gotta do something, yeah. Gary, can you come up real quick?
Yes, sir.
Thanks.
Thank you.
I think what I'm interested in doing is trying to ensure that regardless of whether it's the ABV framework or the original kind of liquor tax language that's already in statute, that we make sure that maybe it's adequately incentivizing local production. Do you think the current language of the bill does that? I know they tried to at least address it, but beyond the draft beer, but for things like local spirits that may be emerging, do you have thoughts on that?
Sure. First, thank you for that. I realize that was an attempt to help the small producers. I think in the current form under HD1, it only benefits brewers, which of course I'm a brewer, but Class 18 means I'm also a distiller and technically a winery as well. So looking at it from all sides, I was just texting with my friend at Maui Wine. There's no benefit for them to produce here, right? And I think we do have to be careful of whether it be interstate commerce or Granholm in preference to local. I think there are ways around that for the class of license and also the being made available to everyone subject to these conditions. So it does make sense. I would argue though that still departing from the tried and true system that even our federal government uses of beer, wine, spirits, and using the base alcohol as the determinant on what rate you pay. I think departing from that would be a poor choice, and it because of the complexity that brings. So while that Class 18 or small producer carve out, if you will, is very welcome, warranted, and supported, I do think it adds complexity when you add in that ABV component.
Got you.
But there are ways to work with you on that.
Sure. Members, any additional questions? Go Rep Gideon and then Rep Miyake.
For our brewing. Roughly how many employees would you say you have across?
Not enough, sir, frankly. I wish we had more. It was one thing we need in Hawaii to support the local businesses. At last count, somewhere in the 4 to 440, somewhere in that range between the 4 restaurants, the production brewery, administrative staff, and we've downsized our team on the mainland. We have 3 people on the mainland now.
What would be the likely impact on jobs, expansion plans, and long-term investment in local manufacturing if the bill did pass as is?
Current form, haven't done too much math given that carve out because I feel like it wasn't right.
General idea.
General idea is there would be no further capex, no further growth plans, no further hiring plans, and a strong push to find mainland production that could be cheap enough to send via the water here, and we'd be domiciled elsewhere. That's just the way it'd have to work if we aim to. The banknote's not going down by the way the rate is going up, right? So we have to figure out something to keep what we could preserved.
Thank you.
And it would be a huge deterrent to anyone who even thinks about investing in the state going forward. Yeah.
Thank you.
Rep Miyake.
I guess for Maui Brewing Company, what percent or what price increase if this bill was to go forward would you expect for consumers?
Speaking for beer specifically and fermented based seltzers, so again, not vodka based seltzers that we make or vodka based sodas. Beer, for every $1 increase, you're gonna see about $1.70 to $2.10 to the customer. And that's because we have a tried and true system, the 3-tier system that our wholesaler partners always applaud. When the landed price goes up to the wholesaler, they tack on their margin to that landed price, which includes the tax. So then it goes up again and again. So by the time it gets to the customer, it had margin applied to it at least 2 up to 3 times.
Okay, thank you. Members, additional questions? Seeing none, we're going to move on to the next item on our agenda. We
I appreciate you.
have, no, thank you for your time. HB 2614 HD1 relating to deceptive practices.
We have a DCCA Office of Consumer Protection in support.
Aloha Chair, Vice Chair, members of the committee. My name is Emma Olson for the Office of Consumer Protection. We will stand on our written testimony in strong support. Available for questions. Thank you.
Thank you. That's all the testimony we received for this measure. Is there anybody else in the room wishing to testify? Anybody on Zoom?
Okay, any questions? No, okay. We have HB 276 HD1 relating to condominiums.
Okay, DCCA Hawaii Real Estate Commission with comments. Not present. Grassroots Institute of Hawaii in support. Not present. Members also testimony in support from one other individual. That's all the testimony we've received. Anybody else in the room wishing to testify? Anybody on Zoom?
Members, any questions on this measure? Seeing none, we're gonna move on to HB 916 HD1 relating to the low income housing tax credit.
Okay, HHFDC in support.
Good afternoon, Chair, Vice Chair, members, Lina Kami with HHFDC. We stand our testimony in support.
Thank you. Department of Taxation with comments.
The department stands on its written testimony.
Thank you. Tax Foundation of Hawaii with comments on Zoom.
Thank you, Vice Chair, Chair, Vice Chair, members of the committee, Tom Yamashika from Tax Foundation. We concur with the Department of Taxation that there will be severe administrative difficulties implementing the bill as written. We urge the committee to do something simpler. Happy to answer any questions.
Thank you. That's all the testimony we've received on this measure. Is there anybody else in the room wishing to testify? Anybody on Zoom?
Okay, questions on this measure? Seeing none, moving on to HB 1711 HD1 relating to housing.
Okay, HHFDC in support.
Mr. Chair, Vice Chair, members, we stand our testimony in support. I would like to highlight that we are working towards implementing our rent-to-own program, and this flexibility would give us, greater opportunities to adjust to changing market conditions. There may be times when we can make the rental period and transition sooner than 5 years. There might be certain times when we might need more than 5 years, which is why we're proposing this measure.
Okay, thank you. That's everybody who indicated they would be joining us today. 2 additional organizations in support, members. Is there anybody else in the room wishing to testify? Anybody on Zoom?
Members, any questions on this measure? If not, we're gonna move on to HB 1713 HD1 relating to school impact fees.
HHFDC in support.
We stand our testimony in support.
Thank you. Department of the Attorney General with comments.
Good afternoon, Chair.
That keeps catching people. It's almost like we're doing it on purpose.
Randall Butt, Deputy Attorney General on behalf of the Department of Attorney General. As outlined in written testimony, the department has comments on this bill. We'll repeal school impact fees, and those school impact fees already collected are to be spent in a certain fashion under Section 5. In order to address certain concerns regarding that complies with the U.S. Constitution as applied to states and under U.S. Supreme Court law, the department has recommended amendments as detailed in our written testimony, and I'm available for questions.
Thank you. Schools Facilities Authority with comments.
Thank you, committee. Ricky Fujitani with the School Facilities Authority. We offer comments on this bill that changes a law that has 20 years of motion with a school impact fee law that has no impact on schools. Where it's headed, we just offer comments on how it carefully has to be abolished, because you want to preserve the money that's been collected and effectively spend it, because we can't find even the people who to give this back to. And that going forward, this is good because it removes hurdles on developing housing. Thank you.
Thank you. Housing Hawaii's Future in support.
We stand on our testimony and support. Thank you.
Thank you. Tax Foundation of Hawaii with comments on Zoom.
Thank you, Chair, Vice Chair, members of the committee, Tom Yamachika from Tax Foundation. There have been issues with spending the school impact fees and its predecessor's fair share fees because of the technical requirements that are now in the respective statutes. I mean, basically, DOE can't spend any of the monies because they have to wait until they have enough to do a whole school. So we have millions of dollars, tens of millions of dollars in the school impact fee accounts, and under current law, they got to stay in there because there's no way that the DOE is going to have enough to build a whole school when you take into account the fact that where the fee is collected is where it has to be spent. So we think a way better solution to the measure is to get rid of the system entirely, lapse the funds to something like the School Facilities Authority. We've attached charts and other data in our testimony. Happy to answer any questions.
Thank you. Grassroots Institute of Hawaii in support. Not present. NIAP Hawaii chapter with comments.
Hey Chair, Vice Chair, members of the committee, Evan, Oe on behalf of NIAP Hawaii. We wanted to revise our comments to strong support. Thank you.
Thank you. That's all the testimony we received on this measure. Is there anyone else in the room wishing to testify? Please just state your name and stance for the record and then you can proceed.
Aloha Chair, Vice Chair, members of the committee, o wau o Oriana Lau, mai ko oihana aina ho'opulapula Hawaii. I apologize that our testimony was submitted late. The department just wanted to note that pursuant to Act 268, which passed into law last session, notes that DHHL is exempt from school impact fees until the noted sunset date of July 2029. I'm available for questions. Mahalo.
Thank you. Anybody else in the room? Anybody on Zoom?
Members, any questions on this measure? Yeah, go ahead.
For Tax Foundation, thank you for being here. Thank you for your information. I'm trying to walk this out because it's kind of been snowballing and not really developing the results that it was intended to do. But I also recognize that there have been a number of charter schools that have been developed over time, kind of releasing some of the pressure for the development of new DOE campuses. And I was just wondering if Tax Foundation had any insight or thoughts around if the funds were lapsed, not only distributing back to DOE but other charter school organizations.
We have taken no position on where they should be lapsed to, but the immediate problem is that they're just sitting there right now and need to be put to use somewhere.
Thank you. Thank you for your response. Thanks, Chair.
Okay. Anything additional? Rep. Miyake?
For SFA. Hi Ricky.
Hi. Afternoon.
If the school impact fees were to be repealed, the funds that are already in there, the fees that are already in the account, would you be able to use it, or per Tax Foundation, should we lapse that money?
I think common saying is to lapse it to us. What the bill's saying is sweep it to us. And I'm pretty certain that if we follow the recent Sheets versus City of El Dorado test and nexus with proportionality, it can easily be met. It could be used for, say, buying a building for a charter school in that district. So there is a nexus, as long as the charter was like a high school that served the entire district, or a preschool, which again serves the entire district. So I'm confident that we can effectively spend the money that's been amassed, and it's not a lot of money, but it could really help like a charter or preschool, which is a different scale of expense, so.
Thank you, Ricky, thank you, Chair. Thanks. Anything else? Okay, if not, moving on to HB 1715, HD1, relating to affordable housing.
HHFDC in support.
Chair, Vice Chair, members, just wanted to further explain the proposal. This really is a different approach to managing our affordable housing inventory. Currently, our affordable units are regulated by a 10-year buyback and short appreciation restrictions. Concerns we hear from home buyers are that in that 10-year period, they gain very little equity and they're stuck in their unit. And we hear from others that, well, after 10 years, they just go to market rates. So this tries to balance both of those concerns. Where home buyers can gain equity, they don't have to stay there for 10 years, but their equity would be restricted to a certain index. And the index that we're looking at is the long-term appreciation of real estate on Oahu, which has been about 4.5% per year. So just giving you a real example of how this could have been applied for the Kapilani Residence project, which was completed in 2018. One-bedroom units there sold for as low as about $400,000. Today, the market units are selling for over $700,000. If this program were in place back in 2018, those one-bedroom units now, they could be sold now for about $540,000. So a substantial equity for those buyers, but still quite a bit below the market rate. And I'll just note that for the Kapilani Residence, yes, all those units will become market rate units in 2028. We can't go back and change the restrictions on them. So this tries to strike some balance where home buyers still gain equity, but prices stay relatively affordable.
Thank you. Office of Planning and Sustainable Development in support.
Aloha, Chair, Vice Chair, members of the committee. Diana Stennis with the Office of Planning and Sustainable Development. OPSD stands on its written testimony and support, and we're available for any questions.
Thank you. Hawaii State Council on Developmental Disabilities in support.
Hi, Chair, Vice Chair, committee members, Daintree Bartolas, Executive Director for the Hawaii State Council on Developmental Disabilities, and we are in strong support of HB 1715 HD1. The reason being is we serve individuals with disabilities and other access and functional needs. In order to live out their lives in certain areas, they need adaptive equipment put in the home, making permanent structure changes. A lot of times those structure changes will not be approved if you don't own your home. By giving them a tool to be able to purchase their own home, they're able to adapt it as they age and live there forever. Thank you so much for this opportunity to testify.
Thank you. That's everyone who indicated they would be joining us in person. Members also testimony in support from the Office of Hawaiian Affairs, 3 organizations and 1 individual, as well as 2 additional organizations providing comments. Is there anybody else in the room wishing to testify? Anybody on Zoom?
Members, any questions? If not, we're gonna move on to HB 1718, HD1, relating to housing.
HHFDC in support.
Testimony in support.
Thank you. Office of Planning and Sustainable Development in support.
OPSD stands on its written testimony in support. Thank you.
Thank you. City and County of Honolulu Department of Housing and Land Management in support.
We'll stand on our written testimony in strong support. Thank you.
Thank you. Navian Hawaii in support.
We stand on our written testimony.
Thank you. That's everyone who indicated they would be joining us. Also testimony and support from City County of Honolulu Department of Budget and Fiscal Services and 1 organization. Is there anybody else in the room wishing to testify? Anybody on Zoom?
Okay, members, any questions? If not, we're gonna move on to HB 1724, HD1, relating to the Hawaii Housing Finance and Development Corporation.
HHFDC in support.
Thank you, Chair. She stands on his testimony in support. We did submit the testimony earlier today.
Yes, I see it came in twice. Okay, thank you. Office of Planning and Sustainable Development in support.
OPSD stands on its written testimony in support.
Thank you. Holomua Collaborative in support.
Holomua stands on its written testimony in support.
Thank you. That's everybody who indicated they would be joining us. Additional testimony in support from from DBED as well as 5 organizations. Is there anybody else in the room wishing to testify? Anybody on Zoom?
Members, any questions on this measure? If not, moving on to HB 1725 HD1 relating to building codes.
Okay, we have the Office of Planning and Sustainable Development in support. Thank you. Hawaii State Energy Office with comments.
Chair, Vice Chair, the LCC Jones, Hawaii State Energy Office. We stand on a written testimony with.
Thank you. International Code Council in opposition on Zoom.
Thank you. Chair, Vice Chair, members of the committee, I'm Brian Imai with the International Code Council. While we largely stand on our written testimony in opposition to the bill's language that would extend the state's building code adoption cycle from 3 years to 6 years, I did want to highlight last year's resolution requesting that the governor, the State Building Code Council, and others develop a strategy to adopt updated building codes. That strategy is currently underway and in process and includes other measures that would provide paid staff for the council for the first time. So we urge the legislature to allow that process to play out instead of advancing a bill that would guarantee that the state remains years behind on adopting modern building codes. Otherwise, we stand on our testimony. Thank you.
Thank you. Pacific Resource Partnership in support. Not present. Plumbers and Fitters, Local 675 in opposition. Not present. BIA Hawaii in support.
BIA Hawaii, we stand strongly by our support on deferred.
Thank you. Grassroots Institute of Hawaii in support. Not present. The National Electrical Manufacturers Association in opposition on Zoom.
Good afternoon, Chair, Vice Chairs, and members of the committee. NEMO stands by our written testimony, but do want to note we strongly support continuing with the triennial building code cycle and not moving to a 6-year adoption cycle. Would also like to echo the International Code Council's comments about keeping up to date on modern building code adoption. But we do strongly oppose this legislation as currently drafted. Thank you.
Thank you. Holomua Collaborative in support.
Aloha Chair, Vice Chair, members of the committee, happy Aloha Friday, and for staying late on a Friday afternoon. I'm sure you're as excited to go home and enjoy your weekend as I am, so I'll try to keep this brief. You do have our written testimony and strong support. Holomua, local nonprofit founded to advocate for policies to keep local working families in Hawaii by making sure they can afford to stay here. We all know the cost of housing in Hawaii is extreme, some of the highest in the nation, and part of the reason is due to the delays in permitting processes. Despite wonderful efforts by the various permitting departments, they're often backlogged, which then can lead to delays in construction, which ultimately that cost is passed down to our home buyers and to our renters as well. Moving the code cycle to a 6-year cycle to allow for a rotating cycle will give time for the state building code, for our various developers and the folks that are a part of the building process to get up to date with the codes, to move things through permitting at a reasonable time, while also maintaining important safety standards, and thus allow permits to get out and free up the permitting that is happening at our permitting departments. Additionally, one thing I think is really interesting about some of the concerns brought up related to issues of safety would be that it's too often now that a lot of folks go ahead and do unpermitted permitting on their homes because of how long it takes to get a permit through the permitting process. That is not a safe process within itself. If we can free up the capacity of DPP and other permitting departments, DPP has come out and said they are in support of this measure, that it would allow actual permitting to happen and be reviewed appropriately and to keep folks from doing unpermitted building on their homes. Available for any questions you may have. Mahalo.
Thank you. NIOP Hawaii chapter in support.
In support.
Thank you. Sierra Club of Hawaii in opposition on Zoom.
Good afternoon, Chair, Vice Chair, members of the committee. Wayne Tanaka with Sierra Club of Hawaii. We are in opposition to this measure, but specifically because of the provisions in Section 5, the code skipping provisions. I think doing code skipping now is kind of jumping ahead. Like it's clear that the permitting departments are struggling with a number of other issues, including staffing, retention, and recruitment, as well as training. So, just deciding that, without any real evidence that we should skip this code cycle and somehow it'll fix those problems, I think that's just only going to compromise the safety of future tenants of buildings that are built with out-of-date codes, as well as increase their costs over time, because all of our codes are actually intended to increase things like energy efficiency, which reduces your long-term costs. But happy to answer any questions, and thank you for your time.
Thank you. We have Gina Thielen in support.
Chair, Vice Chair, members of the committee, my name is Gina Thielen. I'm here in support. I'm a licensed general contractor, have been for 30 years. In addition to that, I serve as a volunteer on the Building Board of Appeals for the City and County of Honolulu. And I'm the Vice President of the Chair of the State Habitat for Humanity Association, as well as the Chair of the Building Codes Committee for BIA Hawaii. Most of my work focuses on the City and County's Bill 7 affordable rentals projects. And I can tell you from firsthand experience that building codes have become very problematic for affordable housing. One of the greatest areas of concern is the pace of change. And I want to emphasize that the 3-year code cycle is not dictated by any level of government. It's not federal, it's not state. It is dictated by the entities that write the codes and sell the codes. Entities that are profiting hundreds of millions of dollars. I also want to emphasize that the original language in the bill, in the act that created the State Building Code Council and the state code, refers specifically to adopting codes on a staggered basis. And I want to emphasize that what this bill does doesn't just simply change to a 6-year code cycle. Our current building codes are actually made up of 7 different codes, 4 of which are written by the ICC and 3 of which are written by different entities. What we're talking about doing is looking at these codes on a staggered basis, so that 4 would be done in one cycle and the other 3 in the other cycle. This is going to allow a greater period of stability with each code, as well as a greater deal of scrutiny for local amendments. With that, I'd like to thank you for your time and be available for any questions.
Thank you. Members, that's everybody who indicated they would be joining us today. Please also note testimony in support from Mayor Kawakami from the County of Kauai and the City and County of Honolulu Department of Planning Permitting, as well as 10 organizations and 79 individuals. Testimony in opposition from 7 other organizations and 18 individuals, as well as 1 organization providing comments. Is there anybody else in the room wishing to testify? Anybody on Zoom?
Members, questions? Yeah?
Yes.
Yeah.
Okay.
Right on. You look a little excited, go for it, yeah.
Thanks. Position request aside, I've been trying to crack this nut for a while now. And understand the code adoption cycle, whether it's our base codes like our IBC, IRC, ICC, all of those, but also our electrical, plumbing, and fire codes. My biggest heartburn, absolutely in support of this, but nobody has been able to answer this question. And if you cannot, maybe you can write me the right answer. Under the Stafford Act, which is how we collect reimbursement funds in the event of an emergency or FEMA dollars, it's very clear under 44 CFR that replacement value is based on the adopted code cycle. And my concern is, if we're adopting every 6 years, are we losing out on potential reimbursement monies in the event of a natural disaster?
I think that's a good point, and I don't have the exact answer for you now, but I can get back to you on that.
Yeah.
Any other
It's
questions?
No,
Thank you.
thank you so much.
I feel like you have more.
Gina.
Yeah.
Gina seems to might have the answer. And I absolutely agree. I think there was a time when they were supposed to be updated, kind of stepping in, right? Our base codes with our other codes and tiptoeing back and forth. Any idea on how this might impact our ability to recoup federal dollars if we don't adopt them in a timely cycle?
Thank you for the question, and actually, yes, I do know the answer to that question, not because I know it personally myself firsthand, but we reached out to Congressman Ed Case's office and received verification in writing that there's absolutely no link between building codes and FEMA's reimbursements in the case of a natural emergency. The only part of FEMA funding that is linked to building codes is what's called a BRIC grant, Building Resilient Infrastructure Communities. And those BRIC grants include a scoring system as to whether or not you qualify for a grant. And 1 point on the scoring system is whether or not you've adopted the most current code. However, FEMA considers either of the two most current publicized model codes to be the current code. So being on a 6-year cycle would not inhibit in any way access to BRIC grants. And regardless of what cycle we're on, it would not impact access to federal reimbursement in the event of a disaster.
And then specifically the Stafford Act under 44 CFR.
That I can't answer, but we can reach out
Can
again.
everybody have a little bit of homework?
Yeah.
Right. Thank you so much. I appreciate it.
Thank you.
Oh, stay seated.
Thank you, Jeff.
Do you have a question?
Chair, I
Go
do
ahead.
I have a question.
Sure.
And thank you. So I'm new to trying to crack this nut, but I wanna try and help figure this out as well. So, I read through the testimony and a lot of it has to do with section 5, and the cycles. And so I'm hoping you can explain to me and perhaps some other members about the staggered codes, and if we were to replace the 6-year cycle with something else, are there any suggestions with what to replace it with?
So unfortunately, I spent a lot of time looking at building codes, not because I like it, the subject, but because it's sort of become something that I've had to take on. What I can tell you is that I believe the staggered adoption is the best system because codes are designed to work together. And what I mean by that is that the ICC, who testified earlier, publishes 4 of our 7 code books. Within each of those codes, there's interlinking references. So for example, if you try to cherry pick which codes are on a 6-year cycle and which are on a 3-year cycle, it really won't work. And because they publish their codes every 3 years, it's really 3 or 6 because we start with their codes, which are called a model code, and work on local amendments from there. I do think that hopefully over time, as enough of states begin to adopt measures like this, that these code writing bodies will get the message and back off to a more manageable timeframe, and at which point we don't have to skip codes. I don't know if that answers your question, but that's sort of the best I could do.
I'm not sure if it answered it, but it did provide helpful information, so thank you.
Thank you.
Members, additional questions? No? Seeing none, we're gonna move on to the next item, which is gonna be HB 1727, HD1, relating to the rental housing revolving fund.
HHFDC in support.
HHFDC stands on its testimony and support.
Thank you. Catholic Charities Hawaii with comments.
Good afternoon, Chair, Vice Chair, and members of the committee. I'm Betty Lou Larson with Catholic Charities Hawaii, and we're here to present comments. We're not opposed to workforce health. We know that's a need. We support that need. What we want to caution the committee and the legislature is the impact it might have on the very low-income housing, which is called low-income housing, tax credit housing. which addresses people at basically 60% AMI or below, but can go up to 80% when they balance things. So it can go up to families at 80% AMI or below. This is what the Rental Housing Revolving Fund started with in 1993, I believe, and it's created thousands of units. It really is the lifeblood of rental housing for that low income and even Ellis population group that are really at risk of homelessness. I mean, many of them, as we know, people move out of homelessness and almost an equal number fall in. These are the families who are at risk, who really need affordable housing. So we just want to express that caution that there's a balance, that as you're looking at this bill and what's going to happen with, focusing on workforce housing, don't forget that, there are 17,000 units according to the latest housing plan, needed for those at incomes of incomes of $30,000 annually or below. So it really is a big population, a big need. And we just ask for a balance and to review that as you're looking at, since it's finance, you're looking at the overall budget. How do we meet both needs and balance both needs for the people in our state? Thank you very much for hearing us.
Thank you. That's everybody who indicated they would be joining us today. Members also testimony in support from DBED as well as 2 organizations. Is anybody else in the room wishing to testify? Anybody on Zoom?
Any questions on this measure? Seeing none, HB 1740 HD1 relating to the Hawaii Housing Finance and Development Corporation.
HHFDC in support. Thank you. Honolulu Collaborative in support. Thank you. That's everyone who indicated they'd be joining us. Members, additional testimony in support from 5 organizations and 5 individuals. Anybody else in the room wishing to testify? Anybody on Zoom?
Members, questions? We're gonna move on to HB 1756 HD1 relating to the Individual Housing Account Program.
Okay, HHFDC in support. Thank you. Department of Taxation with comments.
Department stands on its written comments.
Thank you. Tax Foundation of Hawaii with comments on Zoom.
Thank you, Chair, Vice Chair, members of the committee. Tom Yamachika from Tax Foundation. We're just concerned about the blanks in the bill, and we'll stand there in comments other than that.
Thank you. Jesse Wilson in support on Zoom.
Oh, hello. Hi, I'm Jesse. I've never testified before, so I don't really know what I'm doing. But I do want to support measure HB 1756. I help folks make better financial decisions, and I think this is one way that a lot of young folks, especially young professionals, can get on their way to possibly overcoming the very daunting idea of being able to own a home in Hawaii. I'm born and raised here, and I really am passionate about helping folks in this area. And I think while the IHA will not necessarily solve everybody's problem, it will be another tool in the toolkit to help on the multi-front battle of purchasing a home in Hawaii for locals. I also think it helps to keep locals here and build up a tax base for the future. Thank you for your time. I also submitted written testimony. Aloha.
Thank you. That's everybody who indicated they'd be joining us today. Additional testimony and support from the Office of Hawaiian Affairs, 3 organizations, and 6 individuals. Anybody else in the room wishing to testify? Anybody on Zoom?
Any questions on this measure? Seeing none, we're gonna move on to HB 1842 HD2 relating to government.
Department of Land and Natural Resources in opposition.
Department stands on the thank you.
Thank you. That's everybody who indicated they would be joining us today. Members, also testimony in support from the Department of Accounting and General Services and comments from the Mayor's Office of the City and County of Honolulu and 1 organization. Is there anybody else in the room wishing to testify? Anybody on Zoom?
Okay, you have some questions?
Yes, please. PLNO.
Or opposition to the committee.
So as written, the original bill exempted the Lee Tower from 171(2), which is the public lands definition. We are consulting with the Attorney General's office, but we believe that there is a potential that we may not have jurisdiction over it or management authority over it.
Over
The Lee Tower. So you're asking us to give up West Ridge, which is our fourth highest generating property, for something that we may not be able to collect revenues on. So it would be a loss to the SLDF. And thus it would affect, the operating budget of not only our division, but it would affect other programs and other divisions that we fund.
you understand why we're trying to acquire Lee Place.
I understand, yes.
Okay. And you understand that there's a bigger picture there as far as what's the benefit to the state, as far as leasable properties that we're currently leasing outside. When we did analysis prior, there was what we're currently paying in lease rent for all these properties in urban Honolulu, which is about 300,000 square feet, which is what Lee Place is. Lease rent could almost pay for debt service, right? So there's a benefit to the state if we acquire this. Now, what bothers me about your opposition is, and I understand that you guys are in a silo thinking about, your revenue and this from your division and things like that. But DLNR in general has always been, when it comes to environmental issues and all this kind, what's best for our keiki in the long run and all this kind of different stuff. But this bill is specifically looking at, what's in the best interest of the state long term. And your view is very narrow.
While I understand what you're saying, Representative Yamashita.
Yeah. And you understand we can, your special funds, we can look at your special funds and do whatever we want with it.
Okay, I mean that is your prerogative, and I'm not gonna argue with you.
So in the long run, we can help you if there's a shortfall or anything like that. This is a bigger picture.
Okay, I mean, I'm not, we stand on our testimony, it is what it is for our department and how we function. I mean, our SLDF, I understand it is a bigger picture, and I'm not, like I said, I'm not gonna argue with you.
Because DLNR in general has always testified before this committee on the bigger picture as far as
Correct.
any other division.
I think our issue is that we just have a lot of unknowns with it. We wish that people would, I think when the original bill came forward, we asked for information from the city so we could understand and so we could.
It's not a city bill, it's coming from.
No, I know, but right, to understand what the city was looking at in terms of what they pay, all of that, so that we could better understand what it was that was a trade-off and whatnot. We have no information on that, and I think that's just the problem, is the lack of information.
Did you try and get information from them?
I believe that the past administration has. I'm not sure. I mean, I stepped into this role as is, right? So please bear with me. I am trying my best right now, but I do understand your concerns. I'm not, like I said, I get the bigger picture, but I also need to understand all the facts at hand before I can come up with something that's reasonable, that makes sense for everyone. I mean, I agree with the city's testimony in which, negotiations between the state and the city in that sense would be probably more palatable for everyone.
Did you try and do an analysis of what we're paying in lease rent now? That's for all the different facilities statewide, and then if we acquired the building and what kind of benefit?
I don't have access to that type of information.
Okay, maybe some kind of homework like that should be done also. You're kind of the land division and things like that, so I mean there is some crossover in some of that work, and I suggest that some of that work be done.
Okay, I
Thank
hear
you very
you.
much.
Thank you.
Thank you, Chair.
Thank you. Members, additional questions? Seeing none, we're gonna move on to HB 1868, HD1 relating to housing.
HHFDC with comments.
HST stands on its testimony, offering comments.
Thank you. Hawaii Public Housing Authority in support. Thank you. City and County of Honolulu Department of Housing and Land Management in support. Not present. Catholic Charities Hawaii with comments.
Again, Chair, Vice Chair, and members of the committee, I'm Betty Lou Larson with Catholic Chairs Hawaii. We have comments on this bill. We feel that HHFDC already has the expertise, the ability, and they are working with the legislature on how to revise in the most effective way the QAP. What we would like to suggest that we keep the QAP open to the public. Instead of what this bill says is to invite relevant stakeholders, to only invite relevant stakeholders as recommended by the members of the working group. I feel that really these meetings, there are a lot of interested parties. There's developing disabled, there's homeless, there's people who naturally want to create more housing in many different areas. So this is really a public process, which actually is what's required by the federal rules. They want a robust public input into the QAP. So we would like to focus on that and make sure that it is a very wide open process, that groups are interested, who are interested can have input. And we feel that HHFDC has that expertise. They have invited various groups, and various groups, community groups, have worked with them in the past. So that's just our comment, to keep that process very open so that everyone can evaluate. And we'd like to, I think the group would like to sit down with the members listed in this bill to also discuss what revisions they would see and what the impacts or the efficiencies would be that could be developed through their suggestions, along with consideration or discussions with the public. Thank you very much.
Thank you. That's all the written testimony we received on this measure. Is there anybody else in the room wishing to testify? Anybody on Zoom?
Additional questions on 1868? Seeing none, we're gonna move on to the next item, HB 1920 HD1 relating to the low income housing tax credit.
HHFDC in support.
Testimony and support.
Thank you. Tax Foundation of Hawaii with comments on Zoom.
Thank you, Chair, Vice Chair, members of the committee. Tom Yamachika from Tax Foundation. We will stand in testimony and be stand by for questions.
Thank you. NIAP Hawaii chapter in support.
Stand in support.
Thank you. Sugar Creek Capital in support on Zoom.
Good afternoon. Thank you, Chairman, Vice Chair, members of the committee. My name is Phil Gilman. I represent Sugar Creek Capital, an affordable housing investor. We stand by our testimony in support of House Bill 1920, and I'd like to briefly highlight a few points. The Hawaii Housing Tax Credit is a longstanding proven tool to boost affordable housing supply. And continuing to foster a robust, diverse market of investors in this program is good policy for Hawaii. This bill strengthens the demand for these Hawaii housing credits in the investor market, which in turn will boost investment directly into these developments and help lead to more homes being built. We've also submitted a recommended amendment based upon the updated effective date recommended by DOTAX with the goal of clarifying and simplifying what they would specifically need to track. Thank you, and I'm happy to answer any questions.
Thank you. And apologies, Department of Taxation with comments.
Department stands on its written comments. Thank you.
Thank you. That's everybody who indicated they'd be joining us today. Members, additional support from 3 other organizations. Anybody else in the room wishing to testify? Anybody on Zoom?
Members, any questions for this measure? Seeing none, we're gonna move on to the next item on our agenda, HB 2270 HD1, relating to the down payment loan assistance program.
HHFDC in support.
HHFDC stands on its testimony and support.
Thank you. Office of Planning and Sustainable Development in support.
Okay, please stand for this.
Thank you. Okay. That's everyone indicating they join us today. Also testimony and support from DBED as well as 2 organizations and 1 individual. Anybody else in the room wishing to testify? Anybody on Zoom?
Any questions on this measure? No. HB 2385 HD2 relating to housing.
HHFDC in support.
HHFDC stands on its testimony and support.
Thank you. Department of Taxation with comments.
The department stands on its written comments. Thank you.
Thank you. Tax Foundation of Hawaii with comments on Zoom.
Thank you, Chair, Vice Chair, members of the committee. Tom Yamachika from Tax Foundation. The bill in its current form allows only HHFDC, not the counties, to approve and certify GET exemptions for projects developed under a county assistance program approved by HHFDC. We are just wondering why the county should not be able to certify the exemptions, given that it's a county program and FTC has approved it already. Thank you very much. I'll be happy to answer any questions.
Thank you. That's everyone indicating they join us today. Additional testimony in support from 3 organizations and 1 individual. Anybody else in the room wishing to testify? Anybody on Zoom?
Members, questions on 2385? No. Seeing none, we're gonna move on to HB 2444 HD2 relating to taxation.
Department of Taxation with comments?
The department stands on its written comments. Thank you.
Thank you. Tax Foundation of Hawaii with comments on Zoom.
Thank you, Chair, Vice Chair, members of the committee. Tom Yamachika from Tax Foundation. We are concerned about the complexity of the current system that has a patchwork of different credits and incentives for people who probably can't understand the tax forms in the first place. So we urge simplification of this area.
Thank you. Hawaii Children's Action Network speaks in support on Zoom.
Aloha, Chair, Vice Chair, members of the committee. I'm Nicole Wu from Hawaii Children's Action Network speaks. We all know that housing is basically unaffordable for most working families here in Hawaii. This renter's credit was created back in 1977 to provide some tax relief to renters. In 1981, the credit was set at $50, and just adjusting for inflation, it's a little bit more than $170 now. So the current bill says that it would increase the amount of the tax credit from 50 to 170, which would get us up to where it was for inflation. But another restriction on this tax credit is the income eligibility cutoff. In 1989, that level was set at $30,000 a year. At that time, that was just about at the median household income, a little bit above. So about half of Hawaii's households made less than $30,000 and about half made more. If we adjust that income cutoff for inflation, it would be more than $77,000 a year now. With that eligibility cutoff being stuck at $30,000, fewer and fewer Hawaii families are able to claim this credit. With our minimum wage now at $16 an hour, that's about $33,000 a year. So even a minimum wage worker at full time no longer qualifies for this tax credit. You'll see in my testimony, which is page 5 in the PDF, I have a chart from Department of Taxation that shows how many fewer and fewer Hawaii households are claiming this credit because of that income eligibility cutoff. So I think to reflect the intent of the legislature to create this tax credit to provide some relief to renters, we also need to move that income eligibility cutoff to a higher level. So we suggest amendments to do that. But either way, we support this bill and we thank Chair for hearing this bill.
Thank you. Catholic Charities Hawaii in support.
Thank you, Chair, Vice Chair, members of the committee for hearing us. We support this bill. We think it's a very important bill. We really appreciate that it does look at inflation and raises the individual assessment or exemption or tax credit, to $170. But as just mentioned, it really doesn't meet the need of so many of our Ellis families or even low-income workers who are working full-time. And so we do ask you to please consider raising that cap on the income to $77,000. In fact, a recent report said that for the Ellis families, a survival budget is $99,000, over $99,000. So this would give many of the Ellis families a break and who have families who are working, who have many children or even one child. So we thank you for listening to this and we hope you'll consider this amendment also.
Thank you. That's everybody indicating they would be with us this afternoon. Additional testimony and support from one individual. Is there anybody else in the room wishing to testify? Anybody on Zoom?
Additional questions, members? Yeah, Rep. Temple?
Thank you, Chair. First off, thank you for hearing this bill.
No, it's fine.
Quick question for adult tax, please. thank you, Director, for being here and thank you for answering my questions offline. Just for the committee members and the public. In regards to the low income renters tax credit, could you please provide an updated dollar amount that reflects the inflation from the law's initial implementation to present?
Okay. As noted in the Tax Foundation of Hawaii's testimony, this credit was established back in 1997 at $20 per exemption. It was raised in 1981 to $50. So taking $50 back in 1981 and plugging it into the US Bureau of Labor Statistics CPI inflation calculator, that $50 is now worth approximately $187.
Okay, so the bill states right now 170, but the actual inflation number is 187.
Well, based on the US Bureau of Labor Statistics calculator, and that's how we got the number. So
Okay,
there may be other sources that come up with a slightly different number.
okay. Thank you, Director. No further questions. Thank you, Chair.
Thank you. Anything else? Okay. Now we're gonna move on to HB 2476, HD2, proposing amendments to Article 7, Sections 12 and 13 of the Hawaii State Constitution.
HHFDC in support.
C stands on its testimony and support.
Thank you. Hawaii Public Housing Authority in support.
HHG stands on its
Thank you. Office of Planning and Sustainable Development in support. Thank you. Pacific Resource Partnership in support.
In our written testimony, just wanted to add really quickly to our testimony, Chair and Vice Chair, members of the committee. Andrew Pereira with Pacific Resource Partnership. This type of revenue capture financing has been used widely across the country, and I just wanted to highlight 3 recent projects on the continent that's using this type of financing. The Federal Way Downtown Revitalization Project in Washington State. This is a value capture project that will add $400 to $800 million in construction value, along with thousands of residential units. There's the Viva White Oak development in Montgomery County, Maryland, adding another $2.8 billion of value to that neighborhood and 5,000 new homes. And finally, the Boardwalk project in Oklahoma City, Oklahoma. This is valued at $700 million to $2.5 billion. Mixed use project that will add up to 1,600 units. So this type of revenue capture financing is a tool that's been missing for a long time here in Hawaii, and urge the committee to pass this measure forward. Thank you.
Thank you. Navient Hawaii in support. Thank you. The Hawaii Realtors in support.
Yeah, stand in support. Thank you.
Thank you. Tax Foundation of Hawaii with comments on Zoom.
Thank you, Chair, Vice Chair, members of the committee. Tom Yamachika for Tax Foundation. Our primary concern is excluding these types of bonds from the constitutional debt limit. We think there was a reason why our framers put the debt limit in the Constitution, and ignoring it, we're effectively ignoring it for this type of debt instrument. I'm happy to answer any questions. Thank you.
Thank you. That's everyone who indicated they would be joining us in person. Members, additional testimony in support from HCDA, 8 other organizations and 2 individuals, as well as the City and County of Honolulu Mayor's Office providing comments. Is there anybody else in the room wishing to testify?
That boy just had shots.
Okay. Yes, we got your testimony. Thank you. Anybody else in the room? Anybody on Zoom?
Thank you. Do we have questions, members, on HB 2476? Yep, go ahead.
Okay, thank you. I can't really ask my phone, but maybe Pacific Resource. Then. You know, it clearly states that the revenue has to be solely from the increase, right? So similar to when the mayor's were before us, I asked how is this gonna work functionally? So the only thing that I can think of that would make something like this work, because it's primarily for infrastructure, so sewer, water, so those are all the upfront costs,
Yes.
right? So we're gonna float the bond, and then the revenue has to come solely from the increase. Then somebody has to front the money, right?
So the bond writers, the increment bond would go to the bond writers, the way I understand it, and they would assess how much of that increment would actually be captured. And usually the bonds are written, you know, under that assessment, that prognostication of how much value would be captured. For example, Aloha Stadium, the 98 acres at Aloha Stadium right now captures 0 in property taxes. And so that incremental increase in value as that parcel is built out, that's what would pay back the increment bonds. And some municipalities have gotten very.
But where's the revenue coming from?
So the revenue, you float the bond initially, right? And then so the bond underwriters would capitalize that as essentially like a revenue bond.
No, but because there's no improvements yet, there's no revenue. So
Right.
So where's the revenue from?
So it's up to the bond writers to raise that capital, the way I understand it. I'm not an expert on how these bonds are written.
Like I said, the only way that I see it penciling is somebody has to front the money. So it's gotta be the county, from the private developer, somebody. So you know, and there's a second bill rolling it out. So that's why I'm asking specifically. I wanna understand what the rollout is, and even, you know, in the AG's testimony in the second bill, sorry, Chair, I'm talking about the second bill, but it had concerns about it's not clear on how this thing is gonna roll out.
I think the concern is not necessarily who's gonna underwrite the bond, but I think it was more testimony of like going to the bond council and making sure that
I think that part can be all worked out. I just think at the end of the day is who's gonna front the money and how is it, right? Who's gonna pay debt service on the front end? Because there's no revenue until you actually have something.
Right, so you front the bond first, and then as the revenue starts coming in, then you pay off the bonds.
But you know, that could be years, right? So
it could be a few years, but the good thing about Hawaii is that our value is so robust and our value increases, you know, substantially compared to other areas on the continent, for example, that I think we're ripe for this type of value capture financing. It's being done in 48 other states. It's put in place billions of dollars of infrastructure and led to thousands, if not tens of thousands of units being developed with this type of infrastructure. And PRP research, we talked directly to our home builders, has shown that 30% of the cost of a home, so this is the price of the home that your constituents are paying, 30% of that price is because of infrastructure, because you're asking home builders to put that infrastructure in place. And the model of having home builders like Ho'opili put in $1 billion of infrastructure and trying to get that value back over a period of decades, that model is dead. So this type of value capture financing, if you want these kind of master plan communities, this is the way to do it.
You know, I understand the philosophical.
Right.
I think that's why I just believe it should just be paid for out of property taxes and then just spread over the masses.
Well, this is a great way, Representative, to grow the pie without increasing property taxes on the rest of the population.
But right, in the big beautiful bill, they increased the SALT deduction from 10,000 to 40,000. So by increasing property tax, now it's deductible. You know, so when you spread it over people, you can deduct all of those costs.
Right.
Right. So there's.
But under my time under Mayor Caldwell, what I learned is that the way we keep property taxes low in the city count and city and county of Honolulu is that you grow the pie, right? So you're adding new product and you're renovating old product. So by increasing the pie, you keep the property tax at $350 per $1,000 of value. And this type of value capture financing allows you to separate a district that pays the bond off that increment increase without raising property taxes for the rest of the population.
Yeah, but spreading it over the masses is probably I just believe is a better way to go. You know, but speaking of, you know, so as far as policies that was done during previous administrations, you know, when the consent decree came down for Honolulu and you guys decided to increase fees to pay for it, right? Fees are not deductible on your federal income tax. If you guys did it on property, you could have deducted it, right? So your policy doesn't match up with you know, what is in the best interest of the people. And that's what I'm getting at. Is that I don't know if all these things line up. You know, I'm all for coming up with different tools, but that in itself was a mistake.
Well, I don't wanna, relitigate the Caldwell
Well, it
administration,
just
but
makes, one you can write off and one you cannot.
but I do know, Representative, that with this type of value capture financing, you're not raising everybody else's property taxes. So this is not an increase in property taxes for all constituents, whatever the island they're on. This is a way to grow the pie, have those bonds for the infrastructure
It's gonna be
paid
more
back by the
expensive. Okay,
incremental
is the-
increase of the value of
Is
that
the old
property.
stadium gonna be a housing project?
There's 4,400 units of housing going in.
So basically, if you're gonna front the cost, and you're gonna spread it and you're gonna delay debt service, right, there's gonna be an increase in cost on the back end, and then all that's gonna be incurred by those housing projects, correct?
No, I think I wouldn't agree with that. The property taxes being paid by the new housing units going into the NASID property is what's going to go back to pay the bonds, so that
That's right.
initial
So
bonds.
so those proproperties will pay a higher increase in property taxes.
No, they'll pay the going rate of property taxes, cause right now, Aloha Stadium, with due respect, Representative, is collecting 0 property taxes right now. 0 TAT taxes, 0 GET taxes. So when you get a development with 4,400 housing units going in, paying the $3.50 per $1,000 of value, that's going to raise an enormous amount of property tax value. We estimate $14 million per year, as much as $14 million per year to the county. So some municipalities have gotten very creative. They take that incremental value and they use part of it to pay off the increment bond, and then part of it goes to the general fund. So this is really about growing the pie. It's really a commonsensical way to do this.
Is it gonna be affordable housing?
It's gonna go under the mandates of the city and county affordable housing plan, the regime.
I still think if you spread it, you could bring the affordability down versus if you just putting it on this project, and that's my concern.
Well, as I mentioned,
As far
Representative,
as-
30% of the cost of infrastructure is so a $600,000 condo or a starter home, $180,000 of that is you're paying for infrastructure.
Right. No, and I do believe that infrastructure needs to be paid for by property taxes, so I agree with that part, but I just believe it should be spread over the masses. And
Well, this is a way to spread it over the people that are actually gonna grow that area. So the people that are moving into that area, they're gonna be
and
paying
that's the part
property
that doesn't make
taxes,
sense.
whereas.
If you're gonna make it affordable, you're
they're
gonna
paying
spread
on.
it just among only them.
Sure.
Anyway, okay. Now, okay, so in general, I think, having another tool is fine, right? But I just don't know on this project exactly how it's gonna work, and
It's actually, it'll work great, Representative, for master
Can
plan
you-
communities. You
can
can
you-
actually talk to Tracy Tanaki at DR Horton, and there's master plan communities that have already been approved throughout the state, and the one thing holding them back is infrastructure. So if they have this kind of financing tool where the counties go in, designate a revenue capture district, and then pay for that infrastructure, and then as that development grows out, pay back those bonds, I think it's a
so
common
just do
sense
this
approach.
for the committee then.
Mhm.
Give me a pro forma on the whole thing, right? How that's gonna pencil.
Mhm.
And then we can make an educated or a good decision.
Sure.
I think we should have options going forward, but I just wanna see how it's gonna pencil.
Absolutely.
Okay, thank you very much.
Thank you,
Thank you, Chair.
Rep. Russo?
Question for you. So, I mean, this is essentially a TIF approach, right?
Correct.
And I'm wondering, I share my
HIGBA.
TIF.
Housing infrastructure growth bond.
Right. So, I share my colleagues' concerns and also the preference for publicly invested infrastructure. Widespread investment, that we're investing in the whole thing as a whole together. And I understand that that's not working. I am not convinced that this is the right approach. I see why you are advocating for it, but my question is more about who bears the risk should this fail or falter. Because it has in other jurisdictions. You mentioned that it's being used in 48 other states, but also there have been problems. So I guess with this particular approach, from your lens, and maybe this is a question better posed to the tax foundation or even DOTAX, which entity or which level of government, which set of investors bears the real risk should this kind of approach fail?
Our research shows that this is essentially treated as like a revenue bond, so some of the risk is to the purchasers of the bonds themselves.
And that would be the county or?
That would be actually people purchasing the bond to get a return on their money. But what some municipalities have done when projects run into trouble is there might be some calculations for the debt rating of the city and county or the municipality. So sometimes the city or the municipality steps in and works out a solution to keep the project going and to not affect the bond rating. However, as I mentioned before, Representative Prusso, this has been being done in 48 states, in some states for decades, putting into place billions of dollars of infrastructure. And if one thing Hawaii has going for us is our high value and a high property tax, high property values. And so if there's a poster child for this type of revenue capture financing, I think Hawaii would be it, because our values hardly ever go down drastically.
Thank you, Chair.
Members, additional questions? Okay, seeing none, we're gonna move on to the next item on our agenda, which is HB 2478, a related measure, 2478 HD1 relating to bonds.
We have the Department of the Attorney General with comments.
Good afternoon, Chair, Vice Chair, members. Ian Robertson, Deputy Attorney General. We've submitted testimony offering comments on this bill, particularly expressing concerns over the sufficiency of the issuance process represented in Section 1 that would add a section to Chapter 46.
Yes. Office of Planning and Sustainable Development, in support.
OPSD stands on for testimony in support.
Thank you. HHFDC in support.
HHFDC stands on testimony in support.
Thank you. Hawaii Public Housing Authority in support. Thank you. Pacific Resource Partnership in support.
Stand on our written testimony.
Thank you. Navien Hawaii in support.
Stand on our written testimony.
Thank you. And Hawaii Realtors in support. Thank you. As everyone indicated they would be joining us today. Members, also testimony in support from DBED, the Stadium Authority in DBED, HCDA, Councilmember Bolason from Kauai County, and Councilmember Uhajans from Maui County, as well as 6 other organizations, all in support. Anybody else in the room wishing to testify? Anybody on Zoom?
Members, questions on this measure? Okay, seeing none, we're gonna move on to HB 2515 HD1 relating to workforce housing.
HHFDC in support.
HHFDC stands on testimony in support.
Thank you. Hawaii Public Housing Authority in support.
HPHA stands on its testimony in support.
Thank you. Office of Planning and Sustainable Development in support. Thank you. Chamber of Commerce Hawaii in support.
Jamie stands on expressing testimony in support as well.
Thank you. That's everybody who indicated they would be joining us today. Also, additional testimony in support from HCDA, 3 organizations and 2 individuals. Anybody else in the room wishing to testify? Anybody on Zoom?
Okay, members, questions on this measure? No? Yeah, I know, it kinda was fast, huh? Okay. Next, we have HB 2606 HD2 relating to offsite construction.
Department of Hawaiian Homelands in support.
The department stands on its testimony in support. Thank you.
Thank you. Office of Planning and Sustainable Development in support.
OPSD stands on its written testimony in support.
Thank you. Plumbers and Fitters, Local 675 in support. Not present. Chairs in support on Zoom. Not present. Okay, members, additional, that's everyone who indicated they'd be joining us. Additional testimony and support from 1 organization and 2 individuals. Anybody else in the room wishing to testify? Anybody on Zoom?
Members, questions on this? Yeah, you go ahead.
Yeah, thank you, Chair. For the HHL, your letter noted the limitations on the type and size of offsite construction should be determined by the working group. And then it goes on to say offsite construction production requires a minimum number of units. Curious how you guys got there.
I believe it's noted in the bill in section 2 of the bill, and our comments were that if you make the requirements restricted, then it has an effect on the consequences of who it can be supplied from. So that was our simple comments.
I'm curious for a typical house product that DHHL produces, what's the price range that you guys? For some of your, I know there's the lots and then home, but then you have your turnkey, right?
Correct. It varies because as you know, we fund and provide the infrastructure, and that varies from island to island according to their water, sewer needs. And then the vertical construction is considered separate, as you already know. Right now, our prices range anywhere from 400 to 700,000, and we do see the prices increasing largely because of the cost of lumber and labor and other costs increasing everywhere. But we are doing our best to make sure that it is affordable, and where our beneficiaries struggle to qualify for the loans, we have other subsidy and loan programs for them.
Perfect. I just, for the record, I picked 1,200 square feet because of that math. That we are desperately trying to find housing for our beneficiaries who are at the 80, 100, and 120% AMI. And the affordability when you're at that price range is not $700,000. And so the idea behind this was to try and identify that sweet spot of square footage that actually met the affordability. And then my other question is, you mentioned the minimum number of units to justify the investment of establishing a local-based facility. Is it the goal for DHHL to possibly develop a factory to develop offsite construction housing?
Currently, the department does not have any plans to create such a facility. We would be open to the potential of it if it could, as you mentioned, allow us to pencil out at a better price for our beneficiaries' benefit. But I think our comments were more so geared towards, like I mentioned, not restricting us so much that we are forced then to outsource and purchase from out of state. So if there's ways in which we can support the local economy, we're open to that.
Yeah, so to that point, there's a number of members on the group. Is DHHL or someone from DHHL open to speak?
You are correct, we are not included, but we support the speed task force, and if they in this body would be interested in having our chair or the chair's designee on the speed task force, we'd be open to it.
Great.
Mahalo.
Thank you, Chair.
Anything else? Okay, if not, as announced earlier, the original plan was this would take a little bit longer, so we weren't planning on doing decision making today, so we'll stick to that since we've already announced. We'll be doing decision making at the end of our Monday 10 a.m. agenda. If you look up at the system, we already have agendas for Monday and Tuesday up with a whole bunch of bills. But thank you all for being here, and feel free to reach out over the weekend if something's popped up and you need to talk it out. Any questions? You guys good? All right, we're adjourned.